And
I did.
fantastic.
I'll save that adjective for tomorrow, maybe.
Not today's. Not today's. Well, the situation begins this hour. We'll be taking a look at the newspapers, looking at how COVID is spreading worldwide and the countries that are able to beat COVID, looking at our neighbors. Now that we have our borders closed, what's happening along our borders with Somalia and Tanzania. We'll also be taking a look at what's happening to business. Business has seriously been affected by COVID-19. When you talk about people who've been impacted, very many people talk about just those hand to mouth.
Yeah.
And it's forgotten that there are very many other people who run other small kind of businesses who have basically just shut their doors and they're at home, and that's a lost income. And even for Kenya Revenue Authority, even that pay as you earn of 24,000 and above, they're not getting even a bob.
No.
They're not getting even any kind of income that they will be declared at the end of this year. So we'll be looking at that. And also, Felicien Kabuga is inside.
It is
Now
finished.
inside where everybody else wants him to be. He's been inside at his own desires, but now inside where he wouldn't want to be. After 26 years? Yes.
6 years.
Quite the story.
Quite a story. But also, I think there must be lots of backstories.
Oh, for
Why
sure.
now?
Yeah.
Yes.
Something must have
Yeah.
happened now. Or maybe he just decided, okay, guys, come for me now. I'm old. You can take care of me. Instead of me running around, you can put me up somewhere in The Hague.
I think there are many
Or in
answers.
Arusha.
Yeah, there are many answers from this arrest.
Protect me now. Feed me and do everything.
For the rest of my life.
Take care of me.
Yeah.
I have this and that condition. Just ensure that I have access to my doctors, and I'll be living peacefully. As you start now that case of yours, that will take forever. Maybe, thinking. There must be a reason why now. There's absolutely no way that you can just get convinced that finally investigators were able to track him.
In Paris, no less.
Paris.
Yes, and arrest him at some apartment. No way. Anyway, let's take a look at COVID-19 in numbers.
Right. So
Start with Kenya as always.
let's start with Kenya. 887 cases in Kenya, with 57 cases announced yesterday. And of those 57, quite a number of them came out of Mombasa. 35 cases out of Mombasa yesterday. And so that meant that 22 cases around the country. And so now inching closer to the 1,000 case mark. Took a while to get there, but it looks like Kenya will be there with the numbers that we're seeing every day. I think now we've seen some of the highest numbers recorded in Kenya per day of COVID cases. Maybe Dr. can tell us, does this then mean that they were cases that were walking about Kenya, or is it because that there's more testing going on? We still haven't crossed 2,000 tests
a day.
We've not crossed that mark yet in Kenya. However, we're starting to see an increase in the numbers every day. So it'll be interesting to look at that, specifically for Kenya. And then we saw that, we saw the border close between Kenya and Somalia. We saw the border close between Kenya and Tanzania, hoping to curb the spread of this even more.
Yeah.
If that will work, that will be different. It was just interesting to see that it got to 12 o'clock on Saturday, it got to 2 o'clock, and we hadn't heard anything from
From the president.
from the president, and people were like, okay, so we're done, right? Can we get moving? And then, the axe fell at 4 around then, and people realized, all right, 21 more days, let's go. But it was interesting to note that quite a number of people wanted to leave Nairobi and go up country or wherever it is that they would go.
Yes.
And people were ready to go to bars and drink and think and thought that everything was over. Unfortunately, that was not the case.
I don't know why. There were very many questions on Saturday morning everywhere. What's going to be announced today? What is it going to be extended? I mean, you're like, obviously, it's going to be extended.
Yes.
Okay. But if you look at the kind of extension that you're having, so yes, the on paper lockdown is in effect, but practically, it's like the government is like, well,
Do what you want to do, but we're just
well,
telling
you
you
guys, just for the sake of outlook internationally, we have shut down our borders. We have cessation of movement. We are urging everybody to work from indoors. At the same time, we are complaining that now we are seeing more and more people out. But I think, anyway, that's a conversation that I'd like to us to push at some point.
Yeah.
Like, really, are we on lockdown? Are we not? Are we? What's the difference between Kenya and Tanzania?
Word and deed.
Just
Yeah.
day and night.
Yeah.
That Kenyans are up and about during the day, and at night you have less time to be out and about. Yeah,
That's it.
that's it. Because you think about it, Nairobi is buzzing. People are up and about.
It's busy, yes.
But it was expected. I mean, people were only going to be indoors, stay at home for a certain duration of time. When you're out of supplies, when you're out of the little money that you had saved, you will be pushed to go out and look for something.
Yeah.
So it was just a matter of time.
Sure.
So I think for me, the government, the Ministry of Health, wasted some time, some important time. The first time they did curfew and this partial lockdown, that is the time they should have done as much groundwork as possible. Because on Saturday, when they were saying now we've extended for another 21 days, and my question is, and it's like the first question I asked even the first time, what are you doing within that?
What happens within the 21 days?
Yeah, what happens within? If you are not telling us that you have stepped up the number of feet on the ground, your community health volunteers, your contact tracers, your surveillance team, if you've not stepped that up, if you're still operating business as usual, then we are in here for a long time. So we are not even flattening the curve. We are just prolonging the curve.
That's what we're doing.
Let me tell you, there are many more, and I keep saying that many more cases that are trumping about the country that probably will not ever make it to the national tallies that we see.
Yep.
Number one. Number two, the measures that we see having been put in place, like mask wearing and all this. The truth, yesterday, I decided I was okay, so I was a little bit bored, and I said, okay, let me ask a few questions. And I asked about 30 people, why you wear a mask? Every single person I asked told me, this is so 100% of the people that I asked told me they wear a mask to avoid being arrested by the police.
But that's the case.
Nobody's wearing a mask to protect themselves from COVID or protect others from COVID.
No.
People are wearing it because they're trying to avoid the punitive that might come against them. So even that in itself, I'm going to wear a mask when I go out because I don't want to have to look for 5,000 shillings to pay the police, right? I don't want to have to do that.
Yeah.
So even the measures that have been put in place, people have not, imagine 2 months down the line, since cases been found in Kenya, it has not clicked that there's some virus out there and that we need to protect ourselves from it. What has clicked with people is that there's something happening out here for which I need to do what the government says or I'll get in trouble. And I think that's quite sad that that's the message that has come through, unfortunately.
No, I mean, it's people living the reality.
No, but I mean, that's
And
the
the
thing.
reality
Your
is,
reality
in
is
my
that you
mind,
don't...
there's COVID, but as long as I'm not coughing into someone or seeing someone coughing into me,
It's not here.
Or people's reality,
It's not an
or
immediate
people's
threat.
even bigger reality is that there might be something out there and the government says A, B, C, D. However, I need to survive, right? So in order for me to survive, I need to be out there. And in order for me to be out there, I need to do certain things according to the government. So I'm going to put on the mask so that it allows me to do that thing which is going to keep me alive. All these other things just don't mean anything. Oh, flattening the curve, stopping people from being sick, going into hotspot area means nothing. If I need to go to wherever and it's a crowded market, I'm going to put on my mask because there might be somebody there who's going to pick me up.
report me.
Yeah.
Or
it's mainly it. If you think about it, I mean, why do you wear a mask?
Why do I wear a mask?
Those whole things, don't give me the theory. Be the reality. Why do you wear a mask in public?
Oh, that's for real, because they said I should wear.
Yeah, that's the first thing that comes to
In my
mind.
house,
I mean,
I'll
you're wearing
sanitize
it just
my house.
because.
I'll make sure my children are clean and sanitized and all of this. But out here, I'm going to wear a mask because I've been asked to.
And you don't want to get in trouble.
And I don't want to get in trouble.
Because when you get in trouble,
Now you get exposed to
Now you
the
get
virus.
exposed to the virus.
And that's the truth. And if we don't deal with those realities, we're even going deeper into this problem.
Let's start by taking a look at the weather, and then we look at COVID-19 in numbers globally. This is a situation room. It's Kenya's biggest conversation. In the room this morning, Dr. Mercy Korir, Nduoko, and I'm Eric Latif. Keep it right here for more and more conversations. We'll be looking at the number of COVID-19 cases worldwide, what other countries are doing to combat COVID-19 versus what Kenya is doing to combat COVID-19. Good morning.
Let's look at what the skies promise for this week in Nairobi. Partly cloudy conditions, currently a cool morning at 14 degrees. We'll see highs of 25 and lows of 12 today, with partly cloudy conditions through the day. Nyeri at 14 degrees is partly cloudy, likely to be the same throughout the day, highs of 24 and lows of 12. Nakuru is clear skies all through this morning. We're going to see rain showers in the afternoon with highs of 25. In Eldoret at 13 degrees is partly cloudy. Thunderstorms are forecasted for the afternoon with highs of 22. Looking into Kisumu this morning, it's partly cloudy at 20 degrees. We'll see rain showers later with highs of 27 and lows of 19. It's 26 degrees in Malindi and clear skies this morning. Cloudy conditions to follow. Looking at a wet week in Malindi, highs of 29 today. Mombasa is clear and it's going to be quite sunny for most parts of the morning. Entering into partly cloudy conditions later with highs of 29. Kampala at 19 degrees is mostly cloudy this morning. Intermittent thunderstorms forecasted for the afternoon with highs of 24 and lows of 19. Looking into Dar es Salaam is clear skies at 21 degrees. We'll see highs of 31. It'll be a warm day in the Tanzanian city. In Johannesburg at 8 degrees, it's clear skies all through when the sun comes up. Sunny conditions throughout with highs of 21, and it'll go down to a chilly low of 8. Let's take a look then into Lagos, where we see partly cloudy conditions this morning. And we'll at 28 degrees, we'll see highs of 33 and lows of 26. Taking a look then into London at 12 degrees, it's partly cloudy, highs of 23 and lows of 11, promising to be quite the warm day today. And then we take a look this morning into New York, where it's still almost midnight. However, when the sun does come up, it'll be 13 degrees and cloudy conditions, promising rain today with highs of 18 and lows of 12. Finally, in Paris at 13 degrees, it's clear skies predicted all through today, and indeed a warm week, highs of 24 and lows of 9.
This is a situation now. Ndu, give us the numbers.
All right,
globally.
so
Are we at 5 million yet?
we're very close. 5 million will probably be at that number tomorrow, but right now at 4,801,875 cases around the world. Now, understanding that these cases involve recovered cases, which are at 1.858 million, and deaths, which are at 316,671. So this 4,800,000 that we're looking at involves all of these. Now, the US now is at a third of these cases with 1.5 million and 90,976 deaths. There were some worrying figures that came out of the US over the weekend. Friday, Saturday, Sunday, the lowest number of cases per day was 24,000. So they were looking at between 24,000 and 27,000 cases every day of this past weekend, Friday, Saturday, Sunday. And it will be interesting to see what those cases look like today. The lowest number of deaths in the US over the last 3 days was 1,500, the highest number being 1,800 deaths. So this weekend alone, the US recorded almost 5,000 deaths in the last 3 days. And these are the numbers that they're looking at. 3 weeks after the Surgeon General thought they would have reached their plateau, it still has not happened. And the deaths continue to come in at very high numbers. Russia has taken second place.
It would be interesting, sorry to interrupt, it would be interesting to see the kind of numbers in those states where people are demanding to go back out, where even their local governments are deciding that they want to go back out. Well, not now, but as we continue the conversation. Those guys who are saying that our freedoms are being interfered with, let's see how those states doing.
Yeah, and those are the states of Michigan, Florida, Ohio. If you look at the states around the Great Lakes, Michigan, Ohio, Missouri, Minnesota, those states were really concerned and asking to be let out. We can look at those numbers. Florida, also everybody wanted to go to the beach. We can look at those a little bit of Texas, and a few states in the Midwest. So we can look at that and see now what the numbers are vis-a-vis those
the
who
rest.
are not.
Like New York. So New York, I saw Governor Cuomo saying actually that a number of the people who are turning up into hospital, the source of the people coming into hospital with COVID-19 now is not people who are out. It's not people who are working as essential service workers. It's people who are in their homes.
Right.
So people who've been locked up in home for long and yet they are coming to hospital with COVID-19. And he was wondering, so what exactly? What's happening? A couple of theories coming out. Maybe it's the ACs, because these people live in apartment blocks that have a centralized AC system. So maybe the AC is basically just aiding in spreading the virus.
There was another theory that because across board, the US is greatly seen as a community of people who eat out a lot. So then not being able to eat out meant that a lot of deliveries were then being brought in.
Yeah.
So that's another source whereby, in New York especially, that's another source where Cuomo was saying that it's possible that this could have been that the virus was then being delivered home with food. So that would be very interesting as well.
But then... then we'd be seeing a high number as well of people who are working in those essential services, the restaurant workers and such.
I think they already had their wave, because there's a time when they were saying the essential services providers were actually turning out positive. They're falling sick. So probably they've had their wave. And remember, each time you get infected, you have a window of 14 days. So you could get exposed today, and then it would take you another 14 days. So by the time you're showing up with symptoms, or by the time you're being diagnosed, the person who you are exposed to is probably well. So
I see.
It could explain.
The food industry.
So looking at those numbers,
one here.
What was coming out was the people who are getting hospitalized, the source of admission, 66% are people who are in their homes. Nursing homes, 18%. And then the rest is jails, 1%, the homeless, 2%, the congregate, 2%, assisted living facility, 4%. 66% of people who are just indoors are testing positive. Now, the other guys in Michigan would say, look,
they're staying home.
Stay at home, get this thing, get out, don't get it. See, if you are out and about, you're not getting hospitalized. Those who are staying at home are the ones who are falling sick.
Yep. And for me, the theory on the AC probably works. Okay, the exposure from the deliveries and the AC now to just circulate, because one of the advices that is out there for people is that aerate your spaces as much as possible. If you're in an open plan office, open all your windows so that air circulates. So the more air circulates, the less the chances that particles, whatever, will just sit in and wait and be in one place, because air is always circulating. So if you look at the nature of an AC environment,
it's the same air.
It's the same air that is just circulating in there. So it could explain it, and possibly could explain why in Africa we're not seeing numbers which are as bad as we've seen in Europe, in America, in East Asia, because we live in open spaces. We hardly use AC. In fact, AC is a bother to us guys. So it could explain it.
There we go.
Yeah.
Okay. If we're looking at a few more numbers now.
Yep.
Russia is in second place. This was not the case last week. 281,752. However, with deaths at about 1% of this, 2,631 deaths is what they've recorded. As opposed to Spain, which has almost the same number of cases with 277,717, with then 10% at 27,650. The same thing in the UK with 243,695 cases and 34,636 deaths. So 10% of the deaths, or 10% of the cases have resulted in death in Spain and Russia. In Spain and the UK, as opposed to Russia, which has more cases and then only has 1% of the deaths. Brazil is in 5th place. We saw that the spike that came out of Brazil over the last 1 week, whereby they were recording, triple the number of cases that they had seen previously, and that has put them very easily in 5th place now. It's not a race, of course, but still 241,080 cases with 16,118 deaths. Italy at 225,000 with 435 and 31,000 deaths, just over 10% in Italy.
So let's look at these numbers. When Italy was the epicenter of Europe, of course the deaths were less than 31,000, and yet it was globally being seen like, you could see the story of death in Italy. 33,000 deaths, 34,000 deaths in the UK, and you're not seeing that. You're not even seeing like hospitals are getting overwhelmed. What's the difference here? Because in Italy, the story was, the healthcare system has gotten overwhelmed. Very many people are dying. People are just being picked from apartments and they don't come back. And families are wondering. And Italy had one of the stringent lockdowns in Europe.
I think that when the deaths were occurring in Italy, it was not seen in that manner before. What's happening in the UK has already been seen by Italy. Right, in Italy, and it didn't come as a shock. I also do believe that at the same time, the UK is very protective of these pictures that we saw in Italy, for example. So you're not going to see it out there. You will be told that this is what's happening, but you won't see it. And you can imagine the effect. I mean, as a newsman, the effect that the visual has as opposed to the audio. You hear something and but when you see it, you resonate with it a lot more. And like I said, Italy happened in a manner that it didn't happen in China, for example. We saw people dying in huge numbers every day, and people didn't understand what was going on. So now it's happening in the UK, but guess what? It's happened in another country before. So it doesn't take the world by surprise or storm because we've seen it, right? And safe to say, for the national public relations of the UK, it's not something that they want out there.
But the reality is, are the hospitals in the UK being overwhelmed?
So for me, that's actually the question, because what we saw in Italy was all of a sudden there's an immediate high demand for critical care. But in the UK, could it be that these deaths are gradual? Because as long as you've not surpassed the limit of your hospitals or your facilities, then even if deaths occur and there are many, you've not really stretched your healthcare facilities. So could it be that it is dragged and prolonged as opposed to a sudden surge?
I think so. And at the same time,
but
if you want to also, but you also see what the UK has done vis-a-vis what Italy did. The healthcare system in Italy was quite depressed because you had them calling in medics who had even gone into retirement. So everybody was affected at the same time, right?
Medics.
In the UK, they spent the last 3 weeks making sure that the health force was taken care of. There was testing done in a localized area just for NHS staff. They made sure that they got the health that they needed. So you can imagine everybody was taken care of, number one, so that you have people in hospital taking care of people who needed to be taken care of. And I think that a number of people were sick before they became critical, so they didn't need to be in hospital. By the time they are in hospital, you have a health staff that is already buffered and they're all right to be able to take care of. In Italy, they didn't have that. You had doctors, nurses, medics who were sick at the same time as the general population and dying.
With the general population. And also in the UK, when they now moved from their herd immunity, they put everyone who's old and with pre-existing condition on mandatory lockdown. Stay at home for 12 weeks. We'll provide your medication, we'll provide food, everything. Do not go out. So it could have helped to slow down the death rate.
The deaths also are quite high in the home care centers, the ones that are taking care of these elderly people. But I'm just wondering, the number of deaths in the UK has spiked.
It has.
I mean, in the last couple of weeks, you just see the numbers just rising from 20,000 to now 34,000 within a very short time. So the number of deaths per day has also been high. But it doesn't sound at all as if the NHS is overwhelmed.
No.
No.
I don't think they are.
And
I
yet
don't
people
think
are
it is.
dying. So they're not dying at home, they're dying in hospital, but then they're still dying. And the NHS is not overwhelmed. So why isn't it able to save them?
Could be. Remember, the NHS is 100 years plus old. And your whole idea of something like that is that as many people as possible can access healthcare services.
Yeah.
And your health facilities are even at the most remote place of the country. So that is what it was built for. That is the whole idea of universal health access, universal health coverage, that at the most critical time, you're able to access healthcare services no matter where you are, no matter who you are. So it could be that the NHS finally stood up to what it was initially built to do.
We'll take a look at more numbers around the world. At 24 minutes to 7 o'clock, let's first take a look at traffic. Good morning. This is a Situation Room. It's Kenya's biggest conversation.
It's a Monday morning and there are pockets of traffic expected in certain parts of Nairobi city. Let's take a look at what's happening on Thika Road right now. A little bit of a hold up right around the underpass heading towards Pangani, but it's not so bad. Traffic in and outbound on Thika Road today. It's looking pretty good, like I said, for a Monday. Curfew still continues and the lockdown, or shall we say cessation of movement in certain counties, is still upheld. So likely to see an influx of traffic in and out of the city this morning, people trying to get where they're going or where they shouldn't have been going over the last few days. We'll see what it looks like in a bit on Mombasa Road, right around Syokimau there, the SGR, heading then towards Cabanas and General Motors. A little bit of traffic, but it'll open up and not be too bad as you get down onto the Greater Mombasa Road. Fog's quite low in certain parts of Mombasa Road, so you want to put your fog lights on and approach with caution so you don't get into any unnecessary accidents this morning. All right, we'll take a look around the rest of the country in a bit and see what it looks like and see what to avoid. If you do see anything that you should let us know about, Spice of MKE on Twitter. That's how you can reach us. We'll let everybody know what it looks like and we keep it moving this Monday morning.
Watch the show.
Classic soul, R&B, smooth jazz, neo soul.
Watch us on Facebook, Spice FM KE, YouTube, Spice FM KE, and Twitter at Spice FM KE. Join the conversation on our Instagram handle, Spice FM KE, and you can call in 0719 012 600. Before you start taking a look at newspaper headlines, just tell us the numbers around us.
All right, so we saw over the weekend that South Africa had crossed the 15,000 case mark. 15,574 cases with 574 deaths. So we know that they're rigorously testing as well. Egypt is at 12,000. If we want to look then into East Africa now with what the numbers that we had seen, looking at DRC, 1,455 cases with 61 deaths. Somalia at 1,421. We know that the border with Somalia was closed as of midnight last night. Saturday night, right? So Somalia with 1,455 cases. Kenya, as we said, with 887 cases and 50 deaths.
How many deaths in Somalia?
In Somalia, there are 56 deaths. Okay. So if we look at the numbers now, we want to look at Ethiopia. Still very low with 317 cases and 5 deaths. Madagascar reported their first death over the weekend. So they stood at 286 cases for quite a while. They've risen now to 304 cases, if we want to look now in the Indian Ocean, with now 1 death. South Sudan with 290 cases with 4 deaths. Rwanda has remained steady on 292 cases. We know that they're testing rigorously. We know that the lockdown measures applied and are holding fast. 0 deaths, 292 cases.
This is what, no new cases?
No new cases, actually, for the last 1 week. All right. Uganda, 227 cases. Their cases have increased, we've seen. Whereas 2 weeks ago, they were under 100. Now, 200, twofold, right? Still with 0 deaths. They're also testing. I don't know. I can't remember what the test load is per day that we're seeing, but they were in the thousands per day.
And their lockdown is still in effect.
Yes, lockdown is still in effect in Uganda. Tanzania, we saw that. I just need to get that exact number, but we haven't received 509 cases, which is where they were last week. We were supposed to see on Saturday, which was the day that they had said they would be giving their cases to the world. But this is what we saw last week. At the beginning of last week, it's still the same number, still with 21 deaths. And we know that certain measures have been taken in Tanzania. The health minister has been officially relieved of his duty. Assistant health minister, right? And they're looking at opening up colleges. We'll see that in the news. And starting sports leagues again. Magufuli just wants to get this show on the road, right? Let's move along with this thing. This is what we see. If we want to look at Madagascar, for example, Madagascar is already asking the world to, asking African nations, rather, to quit the World Health Organization. And saying that, look...
Was that real news or was it fake news?
Fake news or not, In this case, fake news or not, if you want to link it to this whole herb treatment and concoction. So it's something to look at. So that's what we're looking at. Libya, one country that we've not really looked at. Libya is at 65 cases with 3 deaths. Very, very low, and they've been able to... do some testing, but it's not rigorous as many other
Which
countries.
Libya government is announcing this? There are several governments in Libya. Who is announcing those numbers?
Let's look at the official government recognized by the rest of the world is announcing 65. We'll find that unofficial governments are probably saying 0. But for now, for official statistics, let's take 65. Okay. Angola at 48 cases, Zimbabwe at 45 cases, Eritrea 39 cases, and not another case since, and 0 deaths. So Eritrea is COVID-free. Okay, that's as per the world's numbers. So that's what it looks like, more or less. Burundi at 23 cases, Gambia at 23 as well. That's what it looks like.
Okay.
The numbers in Africa. And Namibia, another country that we saw.
Yes, Namibia.
Still with 16 cases and not more.
And serious lockdown in effect.
Yes, serious lockdown. In fact, they're not playing there either.
Okay. Ghana?
Right, so Ghana is at 5,900 and so cases.
Ghana was cited by the president actually as one of the countries that had first started relaxing measures and then they realized, oops. let's go back.
We shouldn't do this. See, 5,735 cases, I beg your pardon. It's Nigeria that's at 5,959 cases. They have actually gone back into lockdown now as Ghana and said, no, President Nana said, okay, we tried, it's not working, everybody go back home.
Go back.
Right.
Go back indoors. Okay, so we'll see how these numbers unfold in the days and weeks to come. Taking a look at the newspaper headlines. What do you have as a headline, Dr. Marcy?
So we are in full-blown politics. If you look at the
We never
front,
left.
No. There's a time when you were full-blown coronavirus.
It's all COVID this, COVID the
COVID
other.
this,
Now
COVID
COVID has
that.
just become numbers. So what do you put in the headline?
Yes.
Oh, then that new... Okay, something
So-
more interesting.
Dear Kenyans.
So full-blown politics. So on the Standard, the two main headlines obviously are politics related. The first one, how Uhuru got the numbers in 3 hours. Who's smarter? From double dealing to going underground, the dramatic account of how 4 Rift Valley senators and other allies deserted the deputy president moments before the 45-minute meeting at State House that sacked Senators Kipchumba Murkomen and Susan Kihika from powerful positions in parliament. That story is on page 5 of your copy of the Standard, this Monday's Standard. The story by Jacob Ngetich. So Kapsaret MP spills beans on how senators from deputy president's camp failed to rise to the occasion when they were badly needed.
Quite a dramatic story if you read it, actually. It's quite dramatic. So Oscar Sudi is spilling the beans here, saying
Suddenly.
Yep.
this is what these guys did. And the guys he's talking about are the Senator for Nandi, Cherargei, Senator for Wasingishu, Professor Kamar. Who else? Who are the four Rift Valley senators that are being mentioned? So basically,
Trans Nzoia's Michael Mbito, Professor Kamar of Wasingishu, and nominated Senator Alice Milgo.
Okay. So here is the setup for the day. President has
Cue
called.
music.
Ding, 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 ding.
There you go.
Meeting is supposed to happen at 9 o'clock. Both camps are ready and calling each other and saying, you come for the meeting, and the others are saying, don't go for that meeting. So apparently, the Tanga camp was camped in Parliament, and that's why they were saying, come here. In fact, let's sign letters showing that we did not attend this meeting. So they don't have the quorum that they require. And on the other hand, people were turning up into State House. So by some time, they already had 11 senators. By Monday, 7 a.m., frantic calls. The meeting soon began, and by 9 a.m., State House had 11 senators. Their target was 18 to get the majority needed to occasion the changes. As the State House numbers went up, the Deputy President's team was also urging on its side and asking those loyal to it to stay away from the House on the Hill. They had pitched tent at Parliament, and they were collecting signatures there. So this is what Oscar Sudi was telling Kalenjin radio station over the weekend. He was saying now, DP Ruto was calling some people. Like this man called Cherargei from Nandi. He was called over 20 times by the DP.
22 times.
22 to be specific. Did not pick the phone. Okay? And eventually when he picked the phone, he was just murmuring. You know, saying things. He said he was not going to sign the signature physically. He was not going to Parliament. He was not going to be seen in Parliament. He's not going to be seen anywhere. So he sent a scanned signature. And said, attach it to your thing.
His reason was he was far away from Nairobi.
Yeah.
And that he would not sign the list in person.
And he did the same thing with State House. He signed also the State House one. Same thing he said of the Wasingishu senator, Professor Kamar. So according to Sudi, Kamar had sought protection from the State House group, asking that her name not be made public after she signed. Cheriot informed me that they had called the Wasingishu senator, but she was not picking calls. I tried calling her, but she never picked mine as well. So, according to Sudi, Kamar went to State House, signed the list at the gate, and then turned back without attending the president's meeting. So, Sudi told Ruto, wait, Mzee, just call her.
Kamar.
Just call her. The senator picked the DP's calls, but she kept stammering and saying that she had not signed the State House list. We cornered her after we were told by insiders that she had signed the president's. We also made sure that she signed our list as well so that the truth could be known. After taking us in circles, we, together with Senator Cheruyot, Ms. Kiheka, and Bomet Senator Cheruyot's Christopher Langat, caught up with her at Parliament at 10 a.m., where we gave her our list, and she signed it, despite us knowing very well that she had signed Uhuru's list at State House Gate. Drama.
I'm telling you.
Yeah,
Of epic
this is-
proportions. Good grief.
Yeah, they usually say the truth is stranger than fiction.
Hey.
So, yeah.
Of lists signed and not signed. Eh, eh.
But I think here the biggest story, and they've captured it there, is betrayal in the city.
This is it.
Yeah, when you thought your people were loyal and they would stand by you no matter what, there are no permanent friends, there are no permanent enemies in politics.
Yeah.
Goes to show you, I mean, politicians must also ask themselves many, many times that,
What's in
you
it
know,
for me?
every time. So even when somebody's budding up to you, you must assume that they're taking a United States stance in everything.
Yeah.
As we
What's in
say,
it for me?
The United States will never buddy up to somebody who's not going to give them something.
If somebody, for example,
Yeah.
sees that they are on not the innermost circle of the DPs, then they'll be thinking, well, so Kipchumba Murkomen, Susan Keheka, people like Aaron Cheruyot could say, and everybody can see that they are deep there in the inner circle of the DPs, all right? People like Professor Margaret Kamar could say, well, they call me when they need me. The rest of the time, they
Don't.
they decide things and they let me know. So why do you lie?
I don't think anybody should be surprised of broken alliances or broken relationships. I don't think anybody should be surprised or take it personally. You knew what you were getting into in this point, at this point. So it shouldn't be any kind of eyebrow-raising affair for anybody that, you know, somebody signed or did not sign something. What did you expect? You're getting into a bed with a viper, expect to be bitten.
That's the nature
Simply
of things.
put,
Yes.
It's the game. Don't hit the player.
Yeah, my question now is if at all there'll be any backlash from the electorate considering this betrayal, because if the person they've betrayed has a stronghold on the electorate, on the constituents, then they stand to lose a lot more from this betrayal, quote unquote betrayal.
True.
So it will be interesting to see what the electorate thinks,
That's
because
true,
at the end of the day, they're the decision makers.
Unfortunately, the electorate is swayed by a lot of this drama that you see. People see the drama and they think, all right, so maybe this is actually the way in which things are going. And then you vote based on that sentiment, which should not be the case, like you're saying. And then for you to see that at the end of the day, it was all drama and these alliances are shifting and that people are getting realigned to maybe where would suit them for the next season. It would make the electorate think, okay, so maybe we should actually vote with our heads as opposed to via sentiment.
I wouldn't hold my breath on that one. No.
So
We like the drama more than voting with our heads.
But then people, if you like
think
the
the
drama,
people of
don't
Nandi
complain.
could punish Senator Charargei?
Could or should?
Could.
Do you
Could.
Yeah. They could.
They
Absolutely.
could. Definitely.
Yeah.
They could.
Yes.
They could.
But it's a possibility. It's also a possibility that they may not.
I'm telling you, anything is
I would
possible.
go with
It's
they
a possibility
could.
that they may also abandon the deputy president. So we are assuming that they're stuck.
No, that's why I was saying it would be interesting to see what the electorate thinks and does.
Yeah.
If the deputy president has a strong footing in that part of the country, in Uasin Gishu, in Nandi, Trans Nzoia, which was where the 4 senators are,
Yeah.
and part of South Rift, Bomet, Kericho, if he has a very strong foothold of the electorate there, then these senators stand to lose.
Yeah.
Because people don't forget when you've abandoned somebody at their hour of need. And I think that's the nature of our people in Rift Valley.
They may also just look at the numbers. In Nakuru, for instance, it's not clear what's going to happen.
No,
So,
and Nakuru can go either way. Nakuru can go either way because Nakuru is cosmopolitan. It's 50-50 almost. So Nakuru could go either way. But looking at these other regions where it's tribal alliance is more Kalenjin oriented, then you may find that the senators might have a hard time, or any of the MPs, anyone nominated may have a harder time convincing the electorate to quote unquote forgive them for this betrayal.
It'll be interesting to see, but then And then to see that if the Electorate Act realize that the ballot is more than a formality, because previously it has been that the election has been won way before people get to the ballot, because of the decisions that you're talking about now, the tribal affiliations, those have already been demarcated long before anybody picks up that piece of paper and puts an X or whatever it is that they do. So then you realize that when you ask, could they make a decision? That would only become a reality when you realize that the power to make that possibility happen is not listening to all and not, applying sentiment to all of this drama, but then using your one vote and making a decision with that. That's how you could see that all of this could change. But before that, it's likely that people would feel sorry for one or want to punish the other and make a decision way before you get to the ballot. Yeah.
Historically, if you look at some two cases, there's a time when Senator James Orengo ran for president, and he was anti Raila Odinga, who is the kingpin on that side. He lost terribly. But then now look at the last, the 2017 elections when he was running for Senate. Word has it that he didn't even campaign. And he got an overwhelming majority. So if you're seen not to be aligning with the powers that be in that particular region, depending on who's the kingpin, then you may suffer some consequences. Because between running for president and supporting Raila, what has changed? He's still the same person.
Still the same guy.
Still the same guy.
He was running for president in that one. That's the difference. Did he win the parliamentary seat? I actually don't.
I don't think we can check, but I
this
think
was in the 2002 election when Orengo decided. Orengo was runing for president. Nyachai ran for president. We had two candidates from Nyanza. Now that Raila wasn't.
We also had is it Norman Nyaga, the Pentagon? He didn't get a seat in his.
It's the other Nyaga.
Who's the other Nyaga?
Joe Nyaga.
Yeah. He didn't get a seat just because he was not aligned properly. So these things really, right now, they may not look like they are a big deal, but I don't think the electorate forgets some, and this personality politics, that is, they forget that they've been suffering, they've not had food and things like that. But they don't forget who did not align with my person or with our people. So
he did not win the parliamentary seat. He ran on an SDP ticket. He finished fourth with just 0.4% of the votes. His party lost all of its parliamentary places, as many SDP's leading figures had joined NAC. Remember, SDP was the 97 Kamatsa, Masani and Gilu. Is the one that had actually placed Charity Ngilu as their presidential candidate and had a number of MPs in the 1997 election. So, nation.
Right. I'm going to stay away from Ruto's opposition and all of this other drama. Why deaths at home are worrying. This is interesting because the health ministry has sounded the alarm over the rising number of coronavirus deaths in homes. Kenya recorded 5 deaths during the national tally of fatalities on Saturday. 15 of the deaths were recorded in villages and estates. Their caregivers could be infected and spreading the disease, Acting Health Director General Dr. Patrick Amoth said yesterday, adding that age appears to be a strong indicator of who is likely to die of COVID. And I'm just going to stop there because this is what we talked about before. When we said that, you know what? We could be fine walking about, like even I said previously, just as we started this show, that I'm wearing a mask because I have been asked to. But then this is now when it becomes important. Important across board. But now we can see that it's very clear that the virus cannot live on its own. It needs a host. We take it to the vulnerable. And that's why it needs to be explained. If maybe the way you explain it to a child, then I think that's what needs to be done. Because it is clear now why. The aged, are they moving about?
The ones who are dying at home.
The ones who are dying at home are the aged. So that means it's being brought to them.
Or maybe they had gone out to the marketplace. Something. How do they contract it? It's not necessarily that everybody else brought it to them. The caregivers could have infected them.
Caregivers could be infected and spreading the disease. This is what we're talking about because the caregivers are out and about.
Chances are, if you have somebody who's aged and elderly, they'd be staying at home.
Yes,
they'd be,
chances are they're not
they'd be
walking
dependent
about.
on you.
Yes.
What
You're
age
the
are we
one-
talking about when Dr. Amoth talks about the elderly?
So now, when it comes to Kenya's death statistics,
Alright.
between
Pause, Dr. Mercy. We are going to the top of the hour. Just pause so I can give you today's proverb as we go to top of the hour, and then we'll look at the statistics of the elderly and those who are dying at home in the country. When a handshake passes the elbow, it becomes another thing. This is an African proverb. When a handshake passes the elbow, it becomes another thing. Yeah, mull over that. Top of the hour. Good morning. It's 7 o'clock.
Traffic this morning. Let's see what it looks like on Mombasa Road. Thika Road today is quite heavy. Just around Survey, then getting on to the junction coming off of Kiambu Road. It's not been quite heavy before this, but we see a little bit of it. It's not going to be too bad then as you get off to the underpass. So looking around the city and then into Mombasa and Kisumu city, it's not so bad at all either. Traffic is moving very, very smoothly. Let's see what it looks like in a couple of hours, but for now it looks pretty good. Don't forget you can get to us on Spice FM KE on Twitter. Let us know what you see in case of anything, and we'll let you know if there are any other hotspots at this point. We'll take a look at Mombasa Road in a bit and see what that looks like and how that progresses.
This is The Situation Room, the home of hard-hitting political commentary and penetrating insights about the state of the nation. This is a talk radio experience like no other. The Situation Room, a place for hard truths, debates, and elevated conversations. The Situation Room, witty, political, engaging, deep, controversial. In the room, we have C.T. Muga, researcher, academic, seasoned political observer, a fountain of wisdom in these politically
now that you're not
uncertain
moving
times.
around, especially if you're in Kilifi, you're not moving up and down. So you're listening to us on 97.7. Those in Mombasa, 87.9. In Nairobi, 94.4. In Kisumu, 102.5. Nakuru, 96.0. Eldoret, 96.7. And Nyeri, 90.9. We are live streaming the show on www.spicefm.co.ke, Spice FM KE on Facebook, YouTube, and Twitter. And you can join the conversation on 0719-012-600. Dr. Mercy, now let's take a look at the number of the elderly who are dying and the age of those that are dying.
So, for Kenyans above the age of 60 who have so far been diagnosed with the virus, we have 25 females and 47 males. That should give you 72 in total. Between 50 and 59, you have 44 females and 60 males. That is 104. So 104, if you add 72, that's 176 above the age of 50. Now, when it comes to death, they are the majority. Between 50 and 59, we have lost 11 people. Above the age of 60, we've lost 22 people, which is almost half the total number of people we've lost. So if you look at anyone above 50 years, we have lost 33. That's 66% of your death toll is everyone above 50. Now, when you look at the people, the age group where most of our numbers are, it's people aged between 30 and 39 years. People who are likely to be active, up and about, and taking care of the elderly. They account for 232 of the cases. The people above, of between 20 and 29 years are 200. So half your numbers of people who've been confirmed with the coronavirus are between 20 and 39 years old.
Yes.
These are likely to be the caregivers.
Yes.
They're likely to be the people who are out and about looking for food, going to the market, doing what. So they can actually get the virus
That's
and
true.
bring it home to the people who are elderly.
That's true.
and that's why the elderly now will die.
Now, our classification for those elderly who require giving care and are not living home, and that's what I was talking about. You see, the 50 to 59 in Kenya, those are healthy people. Our president is in that bracket.
They're
He's a
likely
healthy
to
person.
they are likely to have pre-existing conditions.
Likely to have
diabetes,
pre-existing conditions,
hypertension.
yes, but they are moving. They're up and they're mobile. They move up and down. The people in their 60s, unless now we talk about maybe from 70 and above, where the government even recognizes that these are the elderly people. According to government statistics, the one that it gives the 2,000 bob a month is 70 and above. So the 70 and above are the ones that you could say probably now those ones are in a situation where they need to stay at home. Basically, what I'm trying to drive at here is, yes, we are talking about the elderly contracting this virus, that the elderly are, this is above 50, are contracting the virus, but we cannot directly say that it's being brought to them.
Let's
We
look
can
at
also say that they actually
they could
coming
also
into-
be getting it.
Yep.
But let's look at it holistically, where we are in a situation where we are in a partial lockdown in some places, stay at home as much as possible. It's not life like we knew it before.
Yeah.
So chances are, if you do not need to go out, you will not go out.
Yeah.
So if you're 50, above the age of 50, above the age of 60, and you do not need to go out, chances are you will stay at home because you need to, keep as safe as possible. But somebody in that household needs to go out. So chances are they will get
Bring it.
whatever and bring it. If you go out, you're already at a high risk group. You probably have a pre-existing condition, but it means you've chanced because you must go out. Now, when you come home, remember there's the whole stigma around quarantine, around isolation, around testing.
Yeah.
So chances are, even if you fall sick, you are likely to want to chance and weigh so that you do not have to endure all these consequences that we've seen around, where you go into quarantine, you're charged for it, or it's not sure who's going to pay, and all that drama that we've been seeing even as late as Friday last week. If you're tested and you need to go into isolation, you're not sure what will happen to your families. And over the weekend, we were discussing something about now the other big concern for isolation, where the breadwinners, when they're isolated, even if their families are staying back at home, their worry is who will provide for them. Because you are now, quote unquote, detained somewhere.
Yep.
You're not able to go out and about. And if you are the sole breadwinner, then you're worried about your family. So chances are you will not want to get tested. You will not want to get isolated because you're not even worried about yourself, but your family, that how will they survive. So looking at all of these things, I'm not surprised personally that we are seeing deaths at home. And I was actually asking, because I've been seeing that our death rate, our case fatality rate is on the rise. And my question had been why. And for me, it's been looking like the Ministry of Health is not really keen on explaining some of these deaths because, one, are we normalizing death from coronavirus, or are we not doing proper postmortem? And by postmortem, I don't mean the actual postmortem, but a mortality audit of the people who have died so that we can prevent. If people are dying at home because they don't want to go to hospital or they don't want to be taken care of, even if they are vulnerable, then we need to address that because people need not die from COVID.
At home,
Anywhere.
especially.
Anywhere. Because look at Uganda. How come we have a better healthcare system? How come Uganda...
They're not getting to the point where they're recording deaths.
Yeah.
When Dr. Amoth was releasing those, just mentioning this and saying that they're getting concerned because more and more people are dying at home, and then post-mortem indicates that they had COVID.
That's a bigger problem.
What was he saying?
That's a bigger problem because it means this person has been missed all along for you to end up having a posthumous diagnosis at the postmortem table. It means they have been sick for a while, they have gotten critically ill, they have not even gone to hospital, and if
Even
they
a
went to
local
hospital,
health centre.
they were missed. Yes, and remember, Eric, also one of the other things I forgot to say is that with the curfew, the restrictions of movement, the uncertainties, the harassment around, people are not actually going to hospital. People are choosing to stay at home and
Medicate at home.
try and you literally gamble with your life, because one, if you have a way of going to hospital, you don't know who will harass you on the way. Two, most of these people will rely on bodas or your local taxi guy. Those people are not willing to venture out at night because they don't know who will harass them on the way, what will happen to them on the way to the hospital. Because by the time you're getting to hospital, you've probably passed through several checks.
Right.
You've been asked a number of questions. So people are hoping to leave until morning, when it's 5 a.m. when they can go to hospital. So between the time that you could have gone to hospital and gotten assisted, you have deteriorated. By the time you're even getting to hospital, your situation is dire.
Yeah.
Now, when you get to hospital, our emergency healthcare services are not really the best. If you need a critical care ICU in the village somewhere, where do you get that? For a population of 47.5 million
By the
Kenyans, we
time
have about
somebody
500
is sick to a
ICU
point
beds.
where they get critical and the family is just watching them and deciding, let's not go to hospital. I mean, that's a serious decision. And I'm thinking it's probably because of, maybe these people have other underlying conditions as well. And you're known, for example, you've been sickly. You've been sickly for a while. Yes, we're taking care of you at home, and somebody has come and also brought COVID as they're taking care of you. And that has also added into the issues.
It is a possibility.
I'm struggling to see somebody who was healthy last week falling sick, and nobody even thinking that let's take him to hospital, and they have no history of this person being sick. I'm not even saying let's take them to the health center, let's take them to, because Nairobi is closed, but you can still go to hospital within Nairobi. Murang'a is not closed, you can go to hospital within Murang'a, within Nakuru, within Wasingishu, Nandi, everywhere else.
So what people do at times, if you've been healthy, then you fall ill, they would, let's say you fall ill in the evening, they would want to,
Wait until
morning. So that time, even if it's an hour, 2 hours where we are waiting until morning to take you to hospital, things could have gotten worse to a point where when you get to hospital, there's hardly anything much that can be done. So that delay in seeking care is equally as bad as not seeking care itself. So it's not, I don't think it's people will stay with somebody who's unwell at home and say we are treating, but it's just that delayed healthcare seeking, such that by the time you're getting to a hospital facility, by the time you're getting there, things are really bad. And then when you get there, if you get to your local health center and you need to be intubated, put under a ventilator, we know they don't have it. They'll start referring you. So the process of getting referred and whatnot, by the time you're getting to the next center where they can have something to help you, is probably late. Because our healthcare system is not in such a way that if you're somewhere in a remote village in Murang'a, Nyeri, Eldoret, Kisumu, wherever, that you will have the exact care that you need.
That you need at that point.
Yeah.
Also, maybe another important statistic to look at is before the curfew, what percentage of people were actually seeking healthcare services at night? So we say now that number has drastically dropped. And this, when people are coming to hospital at night, they were already in this kind of condition. Because still, looking back at our villages and all, when somebody falls sick at night, unless you have a vehicle, access to a vehicle, access to the motorbike so that you can ferry them to hospital, many would say, all right, let's wake up early in the morning, take them to the hospital.
What we have is just anecdotal data, anecdotal information from the health service providers, where in their own admission, numbers have dropped. People are no longer coming to hospital when they need to, or by the time they are coming, they are either being brought in dead or in critical condition during those during the working hours,
The daytime.
5 to 7 p.m. Because now of all of the issues that I have highlighted. So we could, and this is unfortunately, as a country, we are bad at keeping data. We could be seeing a drastic drop, actually, of numbers of people getting healthcare services at night. Even pregnant women, remember, have been chancing and gambling to wait until morning.
Yeah.
And you can imagine if you're in labor, it doesn't wait. You have to go. But people have actually been gambling to wait until morning to go. So you can imagine if you're still breathing, if you're still conscious and whatnot, we will want to wait until morning.
All right,
Yeah.
you won't be harassed to get out. It would be interesting to see the number of deaths. I mean, if we're looking at Kenya specifically, 50 deaths. Are we able to say that all of those individuals were suffering from pre-existing conditions that COVID then came in and exacerbated to the point of death? Or are we saying that a number of those deaths were purely COVID? Somebody contracted COVID and died of COVID? Or are we saying that they had a pre-existing condition, asthma, tuberculosis, something else, diabetes, that then caused death? Because it would be interesting then to look at that, just like Eric was saying, these people who may be dying at home, unfortunately, the lives that we've lost so far, probably were suffering greatly from something else. And COVID now can be looked at as an opportunistic infection that comes in and then takes away life, whereby they would seek medical attention for this existing condition that they had. But in this case, the psyche then has dampened to the point whereby, all right, so I have this thing, but I don't want to go into hospital because
I don't want to get COVID.
I don't want to get COVID.
In hospital.
Right. So then they get it and then they die, unfortunately, because of what it does to the body.
Interesting conversation. We'll have the conversation about our healthcare seeking, what are we calling it? Habits behavior right now in this COVID era. I will be speaking to the Private Hospitals Association. We'll also be asking you to contribute and tell us what you're seeing around you, what you're actually also doing. This is in the 9 o'clock hour. Now, let's take a look at weather. And then we cross over to Paris and Kigali and find out what exactly happened to this man, Felicien Kabuga. Good morning, 16 minutes after 7.
In Nairobi, mostly cloudy conditions is what we're going to see throughout the day today. Highs of 25 in Nairobi. In Nyeri at 15 is partly cloudy, highs of 24. And in Nakuru at 14 degrees, rain expected early on with highs of 25. Eldoret this morning is partly cloudy at 14 degrees. We'll see highs of 21 with thunderstorms in the afternoon. Rain has been forecasted for Kisumu today. It's likely to be a wet week in the Nyanza part of the country. 27 degrees the high for today, however. Malindi is also forecasted to be a wet week. Partly cloudy conditions follow the sun this morning. Highs of 29 and lows of 25. In Mombasa, it's clear skies. Sunny conditions at 25 degrees. We'll see partly cloudy conditions later with highs of 29. Take a look then into Kampala, where it's mostly cloudy this morning at 19 degrees and light rain showers in most parts of the city. Forecasted thunderstorms for highs of 24 and lows of 19. 22 degrees in Dar es Salaam, and sunny conditions, partly cloudy conditions to follow later with highs of 31 and lows of 22. We'll look down south in Johannesburg at 9 degrees. It's clear skies all through. Sunny conditions in the afternoon with highs of 21. It'll go down chilly though to 6 degrees later on. In Lagos, it's partly cloudy at 27 degrees. Clear skies to follow though as the sun comes full front and center. Highs of 33 and lows of 26. And then in London, where it's partly cloudy at 11 degrees, we'll see highs of 23 and lows of 10 today. Taking a look then into Paris, it's clear skies at 12 degrees, highs of 24 and lows of 8. Wrap things up in New York, where it's cloudy conditions at 13 degrees. When the sun comes up, it'll be a partly cloudy day in New York with highs of 22 and lows of 12. affecting us here and around the world. So, on Saturday, we heard the news that Felicien Kabuga had been arrested in an apartment in Paris. After 26 years on the run, in some cases not on the run, but just hiding in plain sight. Reports having said that, the individuals who were around him had lived with him for so long that they didn't even recognize who he was. He's somebody who kept to himself. He was solitary in most cases, and then intelligence got whiff of the fact that he was in this particular apartment in this Paris suburb, and they arrested him. All right. Now, if you want to look at the history of this case, of this gentleman who is famed, shall we say, for having led the Interahamwe, which then caused the onslaught of millions, in this case, of Tutsis and moderate Hutus in Rwanda, and also owned the Radio Télévision des Mille Collines, and this was one of the channels that was used to propagate a lot of hate within Rwanda. So he was the one who was accused of doing these two things. Now, we know for a fact that Interahamwe led a lot of death, a lot of the slaughter and the butchering that we saw, a huge amount of the raping of women through. So this is what we see now, that he was being looked for, he was being sought after because he gave the command. Now with Radio Mille Collines, what it was is that he then used journalists and anchors to spread the message of hate throughout. So these are the two major things that he was being looked for. Now, after the war broke out and millions of people had died, Kabuga fled Rwanda. And the story is that he hid between Kenya and the Democratic Republic of Congo for a very long time. He was also in Switzerland and he was also in Belgium. But what they're saying now is that over the last 26 years, the longest time he spent was in Kenya, DRC, and now where he was finally caught in France. There was a lot of push and pull between the Rwandese authorities and the French, whereby France was accusing Rwanda of hiding this man and not bringing him out.
Yep.
Unfortunately, they were also accused for speaking a little bit too late, because when this Holocaust was happening in Rwanda, France had very little to say. After 1 million people died, France then spoke up and said, okay, well, this is one of the gentlemen that we know did a lot of wrong in Rwanda. Rwanda, we're asking you to give him up. All right? And I think Paul Kagame was vocal without any kind of shyness or vagary and said, look, you have no right to speak now. And even if at some point we were hiding this man, you have no right to speak, because when things went really awry, you were nowhere. So there was a lot of diplomatic push and pull.
So wait, France was accusing Rwanda of hiding Kabuga.
Yes, they did on very many occasions.
The Paul Kagame administration.
Yes.
Of hiding Felicien Kabuga.
There you go. It sounds ridiculous, doesn't it? Yeah? And we had Kenyan authorities at that time who were also accused of hiding Kabuga in certain parts of Nairobi, where people... and then there was a story that arose at some point that there was a gentleman who was identified as Kabuga, but was not him. He looked like him, but it wasn't him. But we don't know if it's fact, but it was alleged that he was in cahoots with even a current sitting member of parliament in Kenya, bought quite a number of property. His children were in private school here in Kenya. So Kenya welcomed him. Not that they gave him a throne to sit on, but didn't exactly chase him away.
They looked the other way.
Right? Looked the other way when he was doing his business. So he was here for a number of years. We don't know at what juncture he left Kenya and then went to France. But I think it's very interesting that Kabuga was found in Paris, in the same country where the leaders, not once, not twice, accused other countries of harboring him. And then he was found right there under their noses. I think that is very interesting.
Well, they could brag and say that we caught him.
Or
When
they
he
could be
came
accused and say, well, you've been pointing fingers and he's right under your nose. So, I mean, it could have been many things that could have been said at this point. The capture of Kabuga, for me, in this case, is a lot of vindication for a lot of people. There's vindication for individuals. There's vindication for countries. At the same time, and I think most importantly, there is redemption, vindication, freedom for the thousands, millions of lives that were lost at his command, whether it was through radio, whether it was through this vicious militia that was used, whether it was through television. Those lives that were lost, somebody now is being brought to book. Whether he's going to pay for it as an octogenarian, because there's very little left of his life in terms of his years here on earth. However, he's been captured. What will be done, however long the cases will take, there are some people who are rejoicing at this point because now justice might be served.
The French can brag. They caught an international fugitive this time without any death to their officers. Remember Carlos the Jackal?
Yes.
An attempt to arrest him many years ago in Paris ended up with the death of some French officials. But now here they are. They can say, well, we tracked him very well. We finally arrested him. We've been trying to warn other countries where we knew he was hiding.
That this man is here.
That this man is here. But those countries were refusing to cooperate with us. A lot is being said about Europol, Interpol, and all the other international agencies and how they tracked him down. And looking back at, and that's why I started by saying, at 85, Felicien Kabuga could have said, all right, guys.
Tired of this.
Okay.
Here I am.
Sawa, let's strike a deal. What do you want? Okay, come for me. Get all the news, publicity that you want. Come for me, get me now. But that's just, it's based on absolutely nothing. It's just one of those things that you call a hunch. I'm not basing this argument on anything at all.
Just a hunch.
Just to be clear.
Just a hunch.
Yeah, just a hunch. Why arrest him now? How? 26 years on the run, one man on the run. And this is not even a man who you can say had military training. You know, people who you could say this is a terrorist who has had military training, who thinks very well about hiding and taking cover and changing identity and all those things. No, this is an ordinary businessman.
This was an ordinary man who felt that there were certain injustices that were done against his people, and then was able to fuel this passion that he had for something to be done about the status quo with money. Wow. He was a farmer and he had money, and this was going to be able to fuel his passion. And that is what he was able to use it to do. Unfortunately, millions of lives, and look, we don't even want to recount the horror that was meted upon people and what he used people to do. The journalists that he used at the radio station, the journalists that he used, some of them have been accused and are languishing in jail today.
Yep.
Right?
Yep.
He was free. But he had this tool, which if we want to look at it very carefully, a lot of people are going in that direction. He had this tool called money, and he was able to use it to buy these dangerous tools that people then would use
and convince
later
people.
on.
I mean, he was... The fact that it was happening in this lifetime,
yeah,
it's completely, you can't
crazy.
even imagine.
And like you said, he wasn't any kind of intelligence force. He was not an army official. He was just an influential man because of the fact that he had money. And look at what he was able to do.
And for him to have escaped all these dragnets for all those years just means to me that he had an extensive network of people that covered up for him, that facilitated his escape here and there. Because, I mean, if you're, let's say, moving from Kigali to Nairobi to Paris to Belgium, Switzerland, wherever it is, those are so many points in which you could have been nabbed.
Yeah.
So for him to have escaped being nabbed at all of those points, for him to have not been identified by anyone means there was somebody there who was making sure, or somebody who knew somebody who knew somebody who knew somebody in there.
He had hired a good team.
Yes, they were making sure that he is not seen in broad daylight. Yeah.
He
Or
hired
even
a
if he
good team,
was
and
seen in
those
broad
team-
daylight, somebody was paid to look in the other direction.
Yes.
In very many occasions.
And I'm sure he wasn't dealing with those people directly. He must have had people that he trusted who had sworn to protect him, right? And they must have been paid very well. Or he must have... maybe the same way he was able to convince the population in Rwanda to launch these attacks. It's the same kind of... That's the kind of person that he is. He's able to convert you. He's able to actually make you feel and believe that you ought to work for him and you ought to protect him and you ought to do everything that you can in your power.
I would say his power of persuasion was actually quite great in then what he was able to do. You can imagine by the time somebody gets into your psyche, right, to the point whereby you believe that what you're saying actually makes sense, or you believe that what you're saying actually is the truth, by virtue of the fact that he was able to. I mean, we saw stories and we read stories of how he would purchase machetes or give the order for machetes to be purchased, or give the order to. I mean, one of the famous generals that he used was a woman. And what did she do? She was able to give the order for thousands of other women to be raped at will by the Interahamwe, by virtue of the fact that he opened his mouth. So you can imagine the powers of persuasion that he held at his chest, that he was able to do that. It's incredible to even fathom how that could have been.
So will everyone within that network be nabbed? Because everyone that has facilitated, everyone that has hidden him, everyone that has looked away, will this capture then mean all of these people will be rounded up in all these countries where they are?
It's interesting because the people under him, quite a number of the people under him that he gave the order, have already been arrested.
The small fish,
so
to speak.
The people, they're just the ones who carried out the order. But the mastermind behind, that's why his story was so, that's why this story is so big. Because he actually was the mastermind behind a lot of the terror that we saw. And it's likely, just like Eric was saying, that at this point he's thinking, all right, I'm 85 years old. There's very little more than I'm going to be able to do. So other folks that I might pull into will just be collateral damage, right? And okay, so if I'm going down, what else do they need to know? I'm going to give it to them.
I'll give it to them. So at 7:30, let's take a look at traffic, and then we come out of this. We'll still continue talking about Felicien Kabuga and the Rwanda genocide and the suspects and what has happened to them. We'll be speaking to one of the journalists who's followed this story in recent years, and this is John-Allan Namu, the co-founder of Africa Uncensored. He's going to be joining us on the line. We'll also be reaching out to other people, other journalists who've covered this story of Felicien Kabuga extensively. Good morning. This is a Situation Room. It's Kenya's biggest conversation.
On the streets of Nairobi right now. It's not so bad actually for a Monday morning, and especially after we know that Monday is when everybody's trying to get in back from the hotspots where they shouldn't be. Let's take a look at Jogo Road, where it's looking like very slow this morning, inching along. It'll get you to the City Stadium roundabout and then into the CBD without too much of a headache, but it'll be a bit slower than you would like. On Mombasa Road, heading then towards General Motors, it's not too bad. It's moving very slowly, but you'll get out a little quicker than you normally would. Traffic situations have not gotten back to where they were. It's flowing swiftly though. If we want to look into Gong Road, coming out of Westlands, it's looking good this Monday morning. Spice FMKE, that's how you can reach us on Twitter. Let us know what you see. We'll keep it moving, guys.
28 minutes to 8 o'clock. Good morning. This is a Situation Room. In this hour, we're discussing Felicien Kabuga, one of Rwanda's richest men in the early 90s, who is accused of orchestrating and funding the genocide in 1994. He was arrested over the weekend in Paris after 26 years on the run, accused of being in the country. It's been said that he was also in the DRC, in other European capitals. For all those years, back and forth. It even led to the death of a Kenyan who had apparently worked to lure the businessman into some meeting in Karen. And it said that the man was killed by a hit squad. One of the journalists who covered this story, who has followed up the story of Felicien Kabuga, the allegations that Felicien Kabuga is in the country, the allegations that he's being hidden by some prominent people in the government, is John-Allan Namu. And one of the stories that he did was on, following up on Felicien Kabuga. John-Allan Namu, good morning.
Good morning, Eric. Good morning, Du. Good morning, Dr. Korea.
Good morning, John.
Namu.
John, so Felicien Kabuga, he's been arrested.
Yes. Yes.
How did you feel actually when you heard that the man has been arrested?
Um,
Did you say that you'd like to see his image for you to believe?
Oh yeah, for sure. I mean, that was one of the first things. When the news came through, I looked. I think it was my wife who broke it to me, or the other way around. But I looked through multiple sources, and then now some of my old contacts just started, WhatsApping me, to confirm. Yeah, but it was okay. Well, it's not really my place to sort of like share my own emotional feelings about it, because I'm not a victim of the genocide. I'm not one of the victims who matter. But nonetheless, it was a relief to us, to have heard this.
I would say a little bit differently, John. I think you do matter, because I think you tried to unveil a number of truths about what was going on for people then who didn't have an idea, but were still so closely tied to this. Because if you want to look at people who fled from Rwanda, they came to Kenya. People who fled from Rwanda went to DRC, went to France, went to so many different places. And then for you, look, you disappeared for some time, and you had to take your family into hiding. I mean, and that was something that was public knowledge, right? But if you want to then look at the story and how it has unfolded over the last 26 years, who do you think, now that he's been captured, is really free?
Who do we think?
Who do I think now is free because of his capture?
Oh well, lots of people. I'd say. Perhaps the people who he was funding, members of the Interahamwe who perhaps felt differently about what they had done after the fact, and perhaps now want to come out and say exactly what happened. One of the heads of the Interahamwe was arrested in 2010. There's those people. I mean, then of course, my first thoughts are with the people who were victimized by the actions of Felicien and Kabuga. Those are the people who truly are now, free again to, like I said in the reflection that I wrote, free again to hope that, justice actually doesn't have a sell-by date. Justice prevails, no matter how long it takes. And people seem to think that Kabuga is the first person who was arrested after many, many years on the run. He's not. But why Kabuga's case is special is because he did this. He was able to stay free with the connivance of very, very big heavy hitters across the world. Not just in Kenya, but across the world.
Expound on that.
Yeah. Okay, so let me give you the example of what happens in Kenya.
Yeah.
So Kabuga came to Kenya somewhere around July 1994. This was after traveling to Switzerland. The Swiss at the time, rejected him. Yeah. From what we're hearing later, they weren't, he was able to get through that territory. But anyway, he comes back from Switzerland, comes to Kenya. I'm trying to remember from my files. I think he had I can't remember the classification of his passport, but it was a good classification.
Yeah.
He sets up businesses here. He buys property here. I think all of us know about Spanish villas.
Yeah.
Yeah, so the Spanish villas there in Hurlingham, there were a couple of other apartments, right? He sets up nicely, like properly, and
Openly or
openly. At the time, it was open because this was before the arrest warrant was issued.
Yep.
Yeah. So he sets up openly. He puts his children in school. He starts to, prepare to lead a quiet life as a foreign investor in this country.
Right.
And then the penny drops, and the arrest warrant is issued.
Yep.
Remember, Kenya initially was reluctant to help Rwanda, given the close relationship that President Moi and the Juvenal Habyarimana had. But this then changed with Operation Naki. So Kabuga gets arrested. He's taken to Kilimani police station, where he spends a week. But a number of senior Kenyans, I won't name them, because their names are in the joint task force report if anybody wants to look it up.
Yeah.
Yeah. So a number of very senior Kenyans go and start bargaining for his release. He's released. Yeah.
By senior, do you mean political senior or civil service senior?
Both.
All right.
Okay.
Yeah. So there were senior politicians, people in the civil service, very, high-flying lawyers who went to his aid. Yeah. So at the time of Operation Naki, when a number of Rwandan genocidaires were arrested in Kenya, he then is able to bargain for his release.
Yeah.
Yeah. And then he supposedly leaves the country, but we all know that's not true.
Right.
From bank records, that he had bank accounts at Barclays. I think he had bank accounts at CBA, and those bank accounts were being operated. Remember at the time there was no electronic banking,
Yeah.
so those bank accounts were being operated by who? By
Locally.
him.
Yeah.
Yeah. What he then goes on to do is starts to register businesses under pseudonyms, and then starts to move some of his assets to his children, his son-in-law, who then now start to operate on his behalf so that he can live, quietly. But as the noose starts to tighten, and he starts to fall out of favor with people, specifically after the end of the Moi regime, then now things become more difficult, and then he has to live underground, but he still was able to do it with some of the connections that he has.
John, let me take you back to that 1 week where he was arrested and he was at Kilimani police station.
Yeah.
Officially, what was happening? What was happening during that 1 week period? Officially.
Okay. So officially during that time, the arrest warrants had started to be issued by the Rwandan, not the Rwandan government, sorry.
Tribunal?
By the ICTR, yes, the International Criminal Tribunal. And now there was a lot of diplomatic pressure that was being put on Kenya and other countries in the region that were hosting Rwandese genocidaires, on people who fled the country and were suspected to have perpetrated the genocide. That's what was happening. There was a lot of pressure. So then finally, I think Moi relented, and I think he relented on the basis of some threats.
Yeah.
Globally, about withholding of aid. Remember, this is 1997.
Yeah.
We were doing really badly economically.
Yeah.
Structural adjustment was happening at the time, and the government was in dire straits, right? So Moi used this as an opportunity, I think, to sort of like clean his hands with a global community.
Yeah.
And then now the arrests started to happen, and a lot of people were arrested.
Yeah.
Some big fish, some in the middle there, but none as big as Kabuga was arrested here.
Yeah.
Yeah, I mean arrested for a long time. He was arrested, but then released.
And then released.
Yeah.
Okay. Now, there was a gentleman who had been mistaken for Felicien. What was the story there?
So he's escaped the noose a number of times. There was a professor who was mistaken to have been Kabuga.
Yeah.
And a few other people, but I'm guessing the person that you're talking about was the one in my story.
The story that
Daniel.
you did,
Yes.
yes.
Yes. So at the time, I didn't know what had happened, right? But with tracking back to how close it would appear I was, my belief is that there are some people within the cabal of his protectors
Yep.
who were able to access some of my sources, put pressure on them to give me some bad information. Because essentially the photograph was one of the last things that I received before, some of my sources had to go underground.
So you started by, when you started digging up this story, you had sources that were telling you, of course, your story had, some former GSU officers, security agents who were telling you, we actually protected this man.
Yes, well, the people who I was speaking to weren't in the protection ring, but they knew the people who were there.
Okay.
And they knew the story. They had some of the proof.
Okay.
Yeah, and that's how it went. Yeah, but I mean, just again to say here, I don't think there's any journalist worth his salt who would go out to try and shame a person, a living person, who they know is not, the person that they're looking for.
True.
And expect to get away with it. That was something that blindsided me when it came out.
Yeah.
I won't lie. It's something that I feel, terribly sorry over.
Yeah.
But the intention behind it was not in any way to cause any grief or shame to Mr. Ngera and his family, even though that's what it did in the end.
Yeah.
Right.
Yeah.
So, John, if we fast forward if we fast forward 10 years, even 15 years from when it was alleged that Kabuga was hiding in Kenya, and now we see this arrest having happened in Paris.
Yes.
Maybe many would say one of the unlikely locations for him to have been found. In terms of the intensity of this case and the intensity of the things that really happened under his watch in Rwanda, does it then, if we want to look on the global international scale of everything that had happened in Rwanda at that time, do we then want to say that, yes, finally justice can be served on a legal front, if by some way imaginable we can even put aside what people suffered on a legal front, looking at the courts and everything that have been set up since? Would we say that justice can be served, or is it an old man who's given up his fight?
I think justice can be served. And this is why. The evidence that Kabuga participated in the building up of hatred through his newspaper, and more importantly through Radio Television Libre de Mille Collines, is there. It's there in public for all to see. Right? He wasn't doing it privately. Kabuga was part of the Akazu. The Akazu was like the kitchen cabinet of President Habyarimana's, court. And the people who are there, majority of them have been pinned down for the genocide. Right? There have been dozens of people who've come and testified about Kabuga's role. So the evidence exists. To say that an old man should be excused because he's an old man is to deny the fact that this old man is a living, breathing example of the kinds of things that we should never do as humanity. Right? I think people forget that and say that because he's frail, we should forgive him. But, what of the families who lost loved ones? What of the families who are completely eliminated? What of William Munuhe's family here, who for 17 years have been searching for the truth? Josephat Gishuki, Munuhe's brother, has gone to every office in this country. He's gone to the DPPs, he's gone to the attorney generals, he's gone to the office of the president. 2 presidents, not just one, right? The closest he's got is a letter from the DPP saying that there should be an official inquest. But this is 17 years down the line. His father has died. Should we then let Kabuga rest because he's old?
Absolutely not. No.
You see, so that's the thing about justice. I mean, you know what Martin Luther says, right? The moral arc is long, but it bends towards justice. And like I said at the top of this interview, there's lots of other examples of people who were old but were arrested and were taken through the court system, like Demjaniuk, the Polish prison officer, who was arrested, first taken to Israel, acquitted, and then arrested again and taken to Germany, where he died. Yeah, so there's precedent in being able to try people of his age, and it's not so much about his age, but about the weight of the crimes that he committed.
What do you make of these arrests now? 26 years later, the man is arrested at an apartment in France after so many years of evading justice and evading arrest. And like you said, he seems to have had a cabal working around him to ensure his safety. What do you make of this now?
I think it's a lot of effort that the mechanism that that have been investigating the crimes in Rwanda have made to be able to get this close. I've been in touch with people from that mechanism over the years.
Yeah.
Right? Even before I did the Kabuga story, because I was interested in what was happening in Rwanda, and had done a couple of stories at KTN while I was at KTN. The determination of some of these guys to be able to get the officers, to me, honestly, was unparalleled.
Okay.
Right? Yeah, because there'd be an officer who gets in touch, then a couple of years later, a new lead comes out, they get in touch, they want to recheck something that happened, they'll call and get in touch and ask me some questions.
Right.
So it speaks to the determination of a few people who know that their job matters.
Right.
Right. But I think on the more architectural scale of the crimes that he committed, but more so being able to evade justice for 26 years, I think the search for justice also continues by finding the people who helped hide him.
Yeah.
Right.
Yeah. Actually, I was
Yeah,
going to
so
ask you
Yes.
if this net should nab everyone who's been an accomplice or complicit in any way now that this guy has been found and arrested.
Well, yeah, I think what's going to happen is that he's going to be tried at the International Criminal Court for his crimes. But nothing stops any other jurisdiction in which he's been from opening up a new case, using the allegations that have been filed against him to say, okay, well, how did you get here? Who was protecting you? What happened? And that, I think, is also the wider story of Kabuga's being a fugitive, right? He was in Kenya, he was in the DRC, he was, I believe, in Belgium, and then also in France, right? For the people who are saying that now Kenya is off the hook because he was arrested in France, are missing the point, right? Kabuga was one of the richest men in that country, right? He had the ear of the president, the president's wife, right? If I believe, I'd have to go and check my facts, but one of his relatives was actually married into the first family, or had a close relationship. Yeah, meaning that you'd also have international ties.
He had contact, yes.
Remember how close the French governments were to francophone countries in Africa, right? So the Francois Mitterrand government and the Jacques Chirac government, the officials there who would have to answer for how genocidaires, because Kabuga is not the only one, how genocidaires would keep getting into that territory.
Yeah.
Right? I think this is also the product of a much better relationship between France and Rwanda. The Macron and the Kagame governments have had some rapprochement in recent years, and I think this is what this is yielding.
Is a result of it.
People are now willing to talk.
But when you talk about widening the net, John, when you talk about widening the net to other countries to look at the networks that helped him evade justice, I think that's opening up a political can of worms. I personally don't see it happening. Because
neither do I.
No country will, no president or any leader will want to look back at those bygones. The man has been arrested. Let's just forget it.
Well, look, Eric. Nobody thought that the French government would cooperate this so closely. Like a couple of years ago, and you remember when Rwanda's foreign minister, there was an arrest warrant issued for her.
Yeah.
Right?
Yeah.
Nobody thought that a relationship that sour would be on the mend. Right? why this case is interesting is because it shows that in spite of everything that we've believed and analyzed, because a lot of people had kind of given up and thought, look, this man is dead, right? In spite of all we've believed and analyzed, this has happened. Who tells you that a president would be able to, elected in Kenya, for instance, my own wishful thinking, who says, what, we actually have a lot of historical baggage that we need to get through, including obligations to our neighbors to figure out what exactly happened, right? Yeah, there's this precedent for countries that have been complicit in crimes in the past, helping others in the present, right? If you look at the entire history of the Holocaust, the people who perpetrated the Holocaust, a lot of them fled those countries. And it was through those kinds of agreements that people were able to say, okay, now we shall analyze how you got here and take you back. So it's a huge can of worms. I don't disagree. And in the short term, I don't think that there'd be any country brave enough to say, not least Kenya, to say, okay, let us open up the books of our past and see how this guy got here. And also, help the people who are his handlers here, whether they are big or they are small. In the short term, I don't see it happening, but maybe in the future it does, because there's no sell-by date on justice. And remember, murder does not have a statute of limitations.
Well, there you go. John, you alluded to the fact that obviously there were frosty relations between Rwanda and France, specifically with the Kagame administration. Now a number of French presidents have gone through, but now with Macron in place, do you see that those relations can thaw out now with this arrest, with what would be seen as the cooperation to bring somebody who caused such drama in Rwanda to book?
Well, I don't want to speak for anyone in Rwanda, any official in Rwanda, much less a president. But this would definitely be a big thing. Everybody knows the significance of Kabuga, right? Not least Kagame, who was fighting the people who Kabuga was supporting. It would be a very, very big sort of carrot to dangle for Rwanda and it's early in the morning, so my vocabulary. It would be a big carrot for Rwanda and France to, be dangled in front of them, to then now come back and improve their cooperation, because, even before the genocide, there are a lot of Rwandese people who fled to France and have lived lives there and have connections there, because there were three similar incidents, none as big as 94, but there was 59, there was 73, I believe, and then 94. So Rwanda has suffered many, many times, and its citizens have suffered many times, and many of them have gone to France to seek refuge. So if only for those relationships, right, I'd say that this would be a big opportunity. But again, I can't speak for anybody from Rwanda.
Right.
But this is what I'd say.
John, what's the status of the ICTR? Was it disbanded? Is it still sitting? What's happening?
So what happened with the ICTR is sometime, I believe in 2011, 2012, they began to wind it up. Right?
Yep.
But what then the ICTR became is now the MICT, so the Mechanism for the International Criminal Tribunal, right? And so what the mechanism would do is that it investigates cases of genocidaires, and then the cases that it's able to bring now, for instance, with Kabuga, would then be referred to the International Criminal Court.
Okay.
Yeah, so the ICTR, as we knew it, wound down somewhere between 2011 and 2014.
So the mechanism now is like the an investigative arm
exactly
of what happened in Rwanda, and all cases are then taken over by the prosecutor of the ICC.
Yes, but the MICT is also headed by a former prosecutor of one of these tribunals. His name is Serge Bramet.
Yeah.
So I'd say that Bramet would have a role in
the prosecution.
in the prosecution.
Okay.
Yeah.
John-Allan Namu, we want to thank you very much for speaking to us. Oh, Dr. Marcy, did you have one final question?
No.
All right. John-Allan, thank you very much for speaking to us.
All right. Thank you, guys.
I know
Thank you,
when
John.
you had this story come out, you are one of those people who immediately started looking back into your files and remembering what you'd covered on Felicien Kabuga.
Yeah, for sure. I mean, weirdly enough, sorry, I know we're winding up, but
Yep.
in 2019, there were at least 3 occasions where I'd had occasion to look back into the file. That's why some of the things that I'm talking about are so fresh. But this definitely closes a chapter for me.
Great.
Thank you so much, John.
Thank you,
Thank
and
you,
keep doing
John.
the good work
Thank
with
you.
African Censored.
Thank you. Thank you, guys.
Thank you.
Thank you.
So, yeah, the man has finally gotten held by the long arm of the law, the long arm of justice. Let's see how now the next stages unfold at the ICC. When will he ever even actually sit at the ICC? When will he ever get convicted, if at all? Or when will the trial even begin, if at all? You know, all these things are still right up there in the air. This is the Situation Room. It's Kenya's biggest conversation. Coming to the top of the hour. This now is coming to 8 o'clock. Remind you today's proverb. When a handshake passes the elbow, it becomes another thing. What do you think of that when you hear that?
I don't know. It could become more than a handshake. What's the next greeting after a handshake?
And what is it that the African wahengas were thinking of when they thought about this? You know, you should always be watchful when an unfamiliar person is too acquainted with you. All right? When somebody becomes too friendly, be careful. This is no longer a handshake. They could be going up for something else. They could be having something under their sleeves or going up your sleeve for something. Good morning. This is the Situation Room. It's now 8 o'clock.
Bills are being experienced at all stops. Thika Road. Main Road is moving better than the service lane, so you might want to use that as an option now. Service lanes have always been used as a way to get off the main traffic, but it's not happening this morning. It's clear up until Muthaiga at the bridge, but then moving forward, it is quite the chock-a-block situation. The footbridge at Safari Park, there's still people working out. So now there's exercise, gym work happening on Thika Road combined with vehicular and human traffic. It seems to be a mess this morning, guys, but you want to be careful either way. It's really cold in Kitengela this morning. That means the fog on Mombasa Road, the longer part of Mombasa Road is quite low still, even at 8 o'clock. So you want to be careful. Fog lights up, very important this morning. Then other parts of the city seem to be okay. Jogger Road, Ngong Road, coming out of Westlands into the CBD. That seems to be okay this morning. It's Monday. We can't expect less. But it's looking good either way. Spice FMKE, that's how you can reach us on Twitter. Let us know what you see if something does pop up, and we'll share.
This is the Situation Room, the home of hard-hitting political commentary and penetrating insights about the state of the nation. This is a talk radio experience like no other. The Situation Room, a place for hard truths, debates, and elevated conversations. The Situation Room, witty, political, engaging, deep, controversial. In the room, we have C.T. Muga, researcher, academic, seasoned political observer, a fountain of wisdom in these
Now 2.5
politically
minutes after 8
uncertain
o'clock.
times.
Thank you very much for tuning into the Situation Room, Kenya's biggest conversation. This being Spice FM, 94.4 in Nairobi, 87.9 in Mombasa, 102.5 in Kisumu, 96.0 Nakuru, Eldoret 96.7, 90.9 in Nyeri, and Malindi 97.7. We're broadcasting on www.spicefm.co.ke. Watch us as well on Facebook, Spice FM KE, Twitter, Spice FM KE. We're also live streaming on YouTube, Spice FM KE. Now, COVID-19 has had a huge impact on everybody's livelihoods. All right, starting from the president, who is no longer at least getting 80% of his salary. Everybody else has been impacted. Why are you giving me that look, Dr. Mercy?
And I'm just wondering, 80%, does it make a big difference to the president?
To the president. That's not the point. His livelihood has been impacted. Now he cannot, buy a drink like this. He can't call, one of those online deliveries for drinks or whatever, a party.
Eric, I don't think you believe what you're saying.
I know what I'm saying. And I don't believe it. So
okay, good.
And also everybody else. Now, when you talk about people who require social protection, the first thing that comes to very many people's minds is people who work in casual labor. People who are doing casual labor, let's say working in a mujengo. Let's somebody who's goes out, looks for biashara, comes back home. The ladies for washing clothes, such. Or even thinking of the ordinary juakali, somebody who leaves their place, goes and does manual jobs and goes back home. But you also forget that there are small businesses that have been impacted. Very many small businesses have had to close, especially those that are service providers to other bigger companies. When the bigger companies reduce their work scope, everybody else is affected. When you talk about pubs and restaurants, those are SMEs. They're hugely impacted. People who work there are impacted. People who own these businesses are impacted. People who supply to these businesses are impacted. If you think about a restaurant, everybody else who works around that is an SME as well, or in the hotel industry. People who supply food, people who come and clean, people who provide transport, people who are contracted to be distributors of, let's say, alcoholic beverages. When alcohol is no longer being sold in pubs at night or even during the day, then you have a huge impact down the road. We don't often think about the SMEs, right?
No, we don't. I think, like you said, we think about the individuals. We don't think about the small companies who are hiring 5, 10 people, who, when you look at the impact that COVID may have had on them, it's gone, right? They closed down. People have lost their jobs. A company then has lost its ability to function for the next 6 months. So what happens to them? We saw the other day that government in conjunction or collaboration with some banks have decided to boost a number of SMEs around the country. And we've heard time and time again that the government's position is to make sure that the bedrock of the economy is in SMEs. So we're having a conversation this morning with the country director of Invest in Africa, Wangeshi Morioki, who is going to give us a little bit of insight into terms of what is happening and then what kind of buttress is needed for SMEs in the future. Sans COVID.
Yep. Wangeshi, good morning.
Yeah. Good morning. How are you?
We're
good
well,
morning.
thank
Fine,
you.
Thank you.
All right.
And thank you very much for speaking to us this morning.
You're welcome. You're welcome.
Now, we're talking about the SMEs and the impact that COVID-19 has had on this segment of our economy. And especially looking at the what's going to happen now, how many businesses are not going to reopen, how many people are losing their jobs now, how many are not going to get their jobs back coming into the future. As Invest in Africa and other organizations that deal with this sector, might you know, just give us a picture of the kind of impact we're talking about?
Okay. All right. So we're talking about the informal sector here, and SMEs are part of that informal sector. To think about the woman selling tomatoes on the roadside, that's an informal business, or young men running wash cars in an informal settlement, or the guy who sells you sugarcane on the side of the road. All those are informal businesses, and they're the people who really provide us, services right there at the bottom, right on the ground. Now, the informal sector employs about, I would say, over 80%. They provide over 80% of employment in Kenya.
Yep.
And when you look at our statistics, there are about 7 million registered organizations.
Wangeshi, if you don't mind, can I just interrupt you a bit? I think there's something, your line is not very clear, so let's just try and get you on a clearer line.
Okay.
So just stay on the line, speak to our producer, John, and then we're going to get you back on a better line.
All right.
Yes, so Wangeshi, he's going to give us all the statistics. Like she was starting to give us the statistics of the registered SMEs in the country, the kind of numbers that we talk about, the kind of numbers that have been employed in this sector, and the impact. It's going to be a huge impact when you talk about those small businesses. We were discussing this with a couple of friends the other day, and they were saying, very many of our businesses are not going to reopen. Yeah, there are those businesses that have shut their doors, and that's it. They've shut their doors. The hope of them reopening those doors is dwindling by the day. When you talk about even people in the entertainment industry, the other day a friend of ours of the show called in from Kisumu and says, I run an events company, and in the events business, we've basically shut down. Now, if companies are going to come back out of and reopen, and yet they come out and they still don't have a good enough budget for marketing, that's why your event business is actually financed from. If there's no proper budget for marketing, then you're still impacted. Right. What kind of events are you going to do?
Just think about it. If you had an event, if you had corporate events and if that was the lifeline of what you did, right? An event on a Wednesday, and then over the weekend you were busy, Friday, Saturday, Sunday kind of thing, and that was your life. And then the entertainment industry basically shut down with COVID, right? So these events were not happening.
And not just events in terms of entertainment. Look at things like weddings, funerals, which were big events on their own, where you have the wedding planners. Now people are getting people to arrange for them funerals, so that not just your traditional way of, go and bury a body and whatnot. It's been an event in itself. So those things which are a must in life have also changed, where now you get to a point where people are even asking themselves, do we need all of those people? Do we need such a grand, wedding ceremony or funeral ceremony, because of the way COVID has impacted everything? And so those kind of businesses, or those people who are relying on those specific events, which must happen in life, then are equally as disrupted as the people in the entertainment industry. One of the other things I was also looking at is just your barber, your salon. Because I'm looking at you actually ask yourself, do I really have to go and see a barber? Do I really have to go to the salon? Can I do it myself? And so those people who who are a direct service provider, who rely on people to directly offer services, then are impacted just because of the issue of keeping physical distance. So, and those are small businesses, the small enterprises that we are talking about. Right. So it's a major disruption in business.
It's a huge one. Let's take a look at weather and then continue the conversation with Wangeshi Muriuki, the country director of Invest in Africa. We are talking about the impact of COVID-19 on small, medium enterprises in the country. Good morning. This is the Situation Room, Kenya's biggest conversation at 11 minutes past 8.
A little bit in Nairobi at 16 degrees. However, it's still partly cloudy in most parts of the city. We're going to see highs of 24 today with partly cloudy conditions through the day. Nyeri at 16 is also partly cloudy. It'll be remaining this way for most parts of the day. Highs of 24. In Nakuru, it'll be a wet afternoon, but it's sunny right now at 16, experiencing highs of 25 and lows of 12. Eldoret is partly cloudy at 15 degrees. Thunderstorms are expected in the afternoon, likely to go well into Tuesday morning. In Kisumu at 21 degrees, it's partly cloudy. Rain expected in the afternoon. It's, like we said, forecasted a wet week in Kisumu. Today, we'll see highs of 27 and lows of 19. Sunny conditions in Malindi this morning at 27 degrees. Highs of 29 and cloudy conditions in the afternoon, giving into an evening of rain that will take its way through to the morning. Mombasa 26 degrees is clear skies all through the morning. Partly cloudy conditions later with highs of 29. Taking a look then into East Africa, in Kampala, it's mostly cloudy at 20, highs of 25, and then thunderstorms are forecasted for the afternoon. Dar es Salaam at 22 degrees is mostly sunny this morning, partly cloudy conditions later. It's going to be a warm afternoon with highs of 31 and lows of 24. Down south in Johannesburg at 9 degrees, it's mostly sunny this morning, clear skies all through today. Fantastic conditions in the city of Joburg, highs of 21. It'll go chilly though to the lows of 6. And for now in Lagos at 27 degrees, clear skies, and highs of 33 and lows of 26 with partly cloudy conditions in the afternoon.
Stay at home as much as possible. Work from home as much as you can. Reduce the number of people that come to your office.
Spice up your
That
life.
has had it.
Mature, intelligent talk every morning. Spice up yourself.
And the state of their income. Very many workers of this lost their jobs. When you
Mornings
go back to
done right. 94.4 Spice FM, Nairobi.
Now, you're not even sure that it's going to reopen. You've basically, for all intents and purposes, lost your job.
Yep.
We are speaking this morning with Wangeshi Muriuki. She's the country director of Invest in Africa. And Wangeshi, just before we decided to change the line, you were giving us the statistics on the number of SMEs that we have registered in the country.
Okay. All right. Yeah. So thank you very much, and apologies for that. So our country has registered 7 million small and medium enterprises. And about, I would say, 1.6 million of these are the MSMEs, or the informal businesses, who employ huge numbers of that make up the Kenyan labor force. I think in terms of aggregate employment, we're talking about 7.5 million jobs. So we do have lots of businesses in Kenya, but a huge number of them are informal. And, informal businesses just means they're not formalized, they're not registered, so they don't pay tax, that, you won't find them anywhere in the government records, yet they are, creating a huge impact on our economy.
Mm-hmm.
Yeah, so if you're looking at how these have been impacted by COVID, I think they've taken the most hit as we speak right now, because you're talking about the mama mboga who's out there selling vegetables, or the young man running a barber shop, or people doing setting up or running car washes in Nairobi or in Kenya. There are very many of those. So at this particular time, when there is massive disruption, incomes are down, large organizations are retrenching. First and foremost, there is a slump in demand. There is no money circulating. So those businesses are highly impacted. And then secondly, because of the informal nature, it means that they may not be able to access even the emergency response funds that are available. Banks are responding now to support SMEs. Businesses need to be registered. You have to be formal.
Yeah.
You have to be tax compliant. So that's a huge impediment to their, to their response and to their survival at this particular time.
Wangeshi, why is it difficult to have some of these enterprises, even if we're looking at an individual, for example, to get them taxed? And when I say get them taxed, I don't mean removing money from them, but get them compliant. Why is it so difficult? Because this has been a conversation for yonks. Why is it so hard?
Okay, there are quite a number of challenges for these businesses as to why they're not formal entities. The one major reason is just that they lack education, and there's also a conception around what taxation means, business licenses. They don't understand the basic governance principles and how that can help them grow their business. So obviously the first barrier is always the fact that they may not be able to afford the licenses. When you think about the licenses imposed by the Nairobi City Council, the Nairobi County or KRA, they view this as a very punitive measures for small businesses. So that's why we need a lot of education around them to understand why compliance is required for them, because then lack of compliance means that they will not be able to access even finance. And this is why there are small mushrooming, and you do have very small businesses that are not sustainable, that can't scale, because of just that lack of understanding or an information gap. So this is why organizations like Invest in Africa are set up to help these businesses understand compliance. We run an online technology platform where if you have to benefit and access our services, you have to be a formally registered organization. So that's where we start the capacity building to help them understand. So it's so much easier to be selling charcoal by the roadside, and tomorrow you can move from one place to another. It's very, short term. But if you are to look at this from a longer term perspective, we have to build their capacity. We have to make them understand why it's important to be compliant.
But at the same time, Wangeshi, there are many other organizations that are registered, all right?
Yes.
They still operate as small businesses. They are registered. So would we consider those ones formal businesses?
Yes.
Because there's a record of their existence somewhere.
Yes.
So in this category still of registered companies, but they are small and they are hugely impacted. Where do we draw the line for them? Like, how do we define them from small to medium to micro to small to medium enterprises? I mean, what are the numbers that we talk about when you talk about these categories?
Okay. All right. So first of all, the informal sector has the largest category. It's not possible to even count them because the statistics do not exist anywhere. But now, out of the 7 million, 80% of that number is actually small, the micro businesses that are still, yes, they're small, they're struggling to scale. They typically employ less than 30 people. Yes, and they earn a turnover of about 5 million per year. So those are the small micro businesses that do play a key role in this economy. So they're the typical suppliers. They are the consumers of raw materials and goods. You'll find them in corporate supply chains. You'll find them running their hustle somewhere. Yes. So typically, the licensed businesses are about 5.85 million in Kenya out of the 7 million. Yeah, so you're looking at nearly 80% of the constituent of businesses.
Okay. So, I mean, you spoke earlier about the fact that, enter COVID and you have quite a number of companies who have suffered. But then the government of the country, the economic profile of the country as a whole has also suffered because of the fact that a lot of these businesses are not in business, as it were. So in a normal situation, what would it look like, or what needs to happen? Because if we say that there is heavy reliance on these organizations to buttress the economy, what needs to happen so that they can maintain that position, or even, ride above that? What needs to happen?
Okay, so the first thing, is to always look at the legal and the regulatory environment, because that has a huge impact on the survival of these organizations. So I must commend the government. They're trying to do something about it, but we will not feel it. Right now, VAT has been reduced from 16 to 14%. I'm sure you've heard that the turnover tax for these companies is also reduced from 3 to 1%. And then banks have also had some support from government to reduce their cash reserve ratio so that they can improve their liquidity and lend to the SMEs. So generally, from a policy environment, from a fiscal regulatory environment, there is something that the government has done to address the immediate needs. But going forward, when you look at what is required, these businesses, even pre-COVID, were still struggling to access finance from the banks. And what is their biggest pressing point? The pain point is money, liquidity. How do I move from here? They need to buy goods and services. So the first thing I believe is that there must be funding from government, from the DFIs, from the World Bank, from the African Development Bank, to have a fund that can support these SMEs in cushioning them. Yeah, they have done a bit in terms of reducing the taxes, but we need more tax incentives for these businesses. Yes, but what is most critical at this particular point is that the government needs to establish a credit guarantee scheme that cushions these businesses in case of default.
Yeah.
Because, commercial banks will not lend to them. You don't even know who's buying from them. So banks need a way to de-risk the opportunity because SMEs are really high risk. Yeah. So the government needs to do a lot. Private sector also will need to step in and provide ways of saving or salvaging these businesses. And obviously, as we speak, COVID is a health emergency. So a lot of focus and resources are directed towards addressing the health issues because preservation of life becomes paramount at such a point. But as we go forward, we need stakeholders to come together. We can't just depend on the government alone. We need academia, we need government, we need organizations like Invest in Africa, the associations, the chambers of commerce to come together because it's a big problem. You're looking at millions of businesses that are shutting down.
Yep, and they're going to be...
money that is not circulating. Yes, the government that you're talking about is broke, as you know. Even pre-COVID, we were already having challenges.
Right.
Yes, we were broke as a government. So we need to all come together and look at this as one problem in the country.
How would that happen? Wangeshi, sorry, I have to interrupt you there. How would that happen? I mean, it sounds great to say, right?
We need to come
together and have a kumbaya moment and figure out how to sort this out. But how would it happen? The practicality of it. How would this happen to be able to achieve the results that you're looking to?
Yes, it would happen in one sense. Now, we are talking about government that has policymakers. We have membership organizations like the Chamber of Commerce represents thousands of businesses. Invest in Africa has 2,500 businesses. Kenya Association of Manufacturers also has thousands of members. Yes? So if these members can come together on one round table, together with the policymakers and the private sectors, it's going to help us to start laying a focus and taking action towards developing sustainable solutions. Because the problem that we have is that we are very short term. We are responding to a crisis. This is a crisis that must be addressed. But we have to move away from crisis management to start looking at longer term solutions.
But are you saying, Wangeshi, that this kind of conversations have not happened? When we see the president having the roundtable with the private sector, the Kenya Private Sector Alliance taking a lead on this, Association of Manufacturers as well participating in this, Chamber of Commerce, I would imagine that these are conversations that keep happening all the time on how to show up SMEs in the country.
They happen, that's true, but it's still pockets of activities happening in the country that don't necessarily involve everyone. They're not necessarily collective, and it's not a cohesive approach. So right now, if we can continue with the same roundtable in the face of COVID, so we are looking at COVID, not just different issues that the bodies like KEPSA are advocating per time. But I must also recognize that we've made some progress through those roundtables. So last year, for instance, Kenya launched the first MSME policy index. So there's a way in which we are going to be gauging government regulatory environment and measures they're taking to support these businesses on a yearly basis. But what I'm saying right now is that business needs high-touch business support and advice. They need to know how to manage their cash flow for the next 3 months. So how is the government going to support those businesses? Who is close enough to provide that kind of advice? It's the business membership organizations. Yeah,
Yep.
it's the chambers of commerce. It's Invest in Africa. It's the mentors. Unless they're together providing the same solutions, how is this going to happen?
So
Yeah?
if we were to look at it practically, Wangeshi,
Yeah.
if
Yeah.
let's say tomorrow there was a meeting and Invest in Africa was participating in this meeting, what would you call for immediately to address the needs of the SMEs that have shut down their businesses now and they're looking at COVID and let's say even thinking about reopening their businesses? What is it that you would call for now?
I would call for two things. Number one is to provide high-touch business support to those companies. They need to repurpose, they need to pivot, and they need to get out.
Big
of the
words.
crisis.
What's that? What does that mean? So let's start
What
with the
that
high touch what?
Repurpose?
High-touch business support to repurpose,
Okay.
to rethink. So, for instance, you've been manufacturing your goods from the house. You sell and deliver your products to individual customers because you market on Facebook.
Yeah.
They need to get onto online platforms. How do they do that? These businesses need to partner. So they need somebody to work with them. Right now, all these businesses are part of a network. We're in a connected world.
Yeah.
You'll find them in a membership body somewhere. So my take is that the high-touch business support must run through networks where these SMEs are. So if you support the chamber to provide support to the SMEs, you're touching thousands of businesses. If you provide support to Invest in Africa, you're talking about 2,500 businesses getting high-touch support.
So how would this happen? Like now during this COVID period, many of these businesses, like you're saying, somebody makes kiondo, somebody makes kikois, and whatever they make, they've been supplying to individuals or to small businesses as well. And they're looking to what you call pivot and get out of this COVID-19 era. How would this high touch business support look like? Is it seminars? Is it financial support? Is it somebody setting up the Facebook page for them or training?
E-commerce?
What is it that they would do?
Is it e-commerce? So like I said, there are two things. High-touch business support means that you provide them with advisory, consultancy, training to help them to pivot. And pivoting could be setting up an e-commerce platform. It could be going online. It could be rethinking your value proposition. It could even be getting into a new business. But that needs money. So the second solution is funding. They need loans. They need money. So it's capacity building and financial support. The banks will not lend to those SMEs. I'll tell you for sure, because there is high risk.
Yeah.
That is why we need a way to cushion the banks to support them to lend to the SMEs. We need to strengthen the SACCOs. We need to strengthen the cooperatives, the microfinance institutions to lend to the SMEs. So two things.
Okay,
Capacity building and funding
And
support.
funding.
Yes.
I can see where, for example, some companies shut down, right? And they don't have any money because sales stopped the day business stopped. They were not able to sell anymore because somebody practically walked into your shop and bought, right? And that changed.
Yes.
And if we look at some of the companies then who maybe would then delve into things like e-commerce, lack of capacity then have now disabled them from going towards full potential. So I can see why maybe training and things like that, capacity building for them would work, right? And then how can you expand? How can you make it better? How can you pivot, as you said, to move around to access this? What about the companies that are stuck in the mud? Literally, come the 15th, 16th of March, when things shut down, they shut down. There was no money. There was nothing flowing. They couldn't do anything. They stopped. What happens to them? Because the forecast looks like for them, even after COVID, there's no coming back from this thing. What happens to them?
So what happens to them is, and there are many businesses like those. They are not just a handful. There are actually very many. We do have them on our network. So if I may just maybe outline some of the measures we are taking to support some of those businesses. As Invest in Africa, because we are SME focused, we've come up with a COVID-19 SME survival toolkit, which is an emergency program to provide vital business support to those businesses that are struggling. So this comes in the form of webinars, for instance. We've got resources and toolkits because businesses that have shut down may have to rethink a new business. How long does that take? You need to understand the basics. You need to understand what it takes. So we've got coaches, we've got mentors, we've got resources, and we're running webinars on a weekly basis to help these organizations quickly understand, pivot, and repurpose.
Let's take a short
and
break.
we'll have very many of them,
Let's take a short break, Wangeshi, and continue the conversation. The conversation this hour is the support for SMEs during this COVID period. And we'll open up the phone lines now. You can call in and give us your own experience or your own thoughts on what needs to happen to support the SMEs, very many SMEs that shut down their businesses or that have been severely impacted by COVID-19. 0719-012-600. That's 0719-012-600. What's your experience on the SME front with this COVID-19? Do you own a business? Have you shut down? What is it that you're thinking about? Do you know somebody who was running a business pre-COVID and after the 15th of March, basically that business just went under? And what's happening to them now? What are the thoughts that we have to revive these businesses? Good morning, 26 minutes to 9. This is A Situation Room. It's Kenya's biggest conversation. On the line with us is Wangeshi Muriuki. She's the country director of Invest in Africa.
A little bit of a build-up that there was right around Thika Road. It's still there from all stops, moving then towards the Muthaiga turnoff and at the bridge as well. It is bumper to bumper, but it is moving slowly all the same. We'll see what that looks like in a bit, but you want to be aware that that'll take you some time to get out of there. All right, there seems to be a Sako Matatu operation that is on strike today, so a number of people are not able to access public transport because of this. We don't know why they're striking, but all right, I'm sure we'll find out in a bit. Mombasa Road coming off of Cabanas and then getting to the General Motors. That's a usual hotspot on Mombasa Road, but it's not too bad. You'll be able to get out of it really quickly. Other parts of the city, though, looking pretty good. Coming off from Ngong Road, coming off of Langata Road, getting to the Nyayo Stadium roundabout to Huru Highway is bumper to bumper, but it'll open up right about 8:30. We'll see what it looks like in a short while. You shouldn't be too stuck this Monday morning. Spice FMKE, that's how you can reach us on Twitter.
This is the situation that's being the biggest conversation in the room this week is Eric Clarkson from the Master Career and
Spice up your
now,
life.
Do you run a business? Do you run a small business? Did you shut down your business during COVID-19? Now, because we were asked to stay at home, work from home.
Mature, intelligent talk every morning. Spice up yourself.
Kind of business, small, medium, and even micro. Whatever kind of service that you provide, we'd love to hear from you. 0719-012-600. What's happening to your business right now? What would you like to see the government do for you? What would you like to see the industry do for you in terms of even thinking how to reopen your business, how to stay afloat during this time? Mm-hmm. You know, some things that people also forget is that also during this time, you still have obligations. Mm-hmm. You still have got obligations. You've got the obligations with KRA, with NSSF, with NHIF. You still have got obligations with your own, the people that you owe money to, and you still have a lot to keep your business afloat. What exactly is happening? 0719-012-600. On the line with us is Wangeshi Muriuki. She's the country director of Invest in Africa. And Wangeshi, just before we went into that break, you were discussing what is it that ought to happen to keep these businesses running. You're saying as Invest in Africa, you've come up with a COVID-19 toolkit. And this toolkit, you're basically disseminating it through webinars and all. But what is it? What practical support are you offering to businesses now with this toolkit?
All right. So the practical support we're offering is to bring experts, business coaches, and partners that Invest in Africa works with, like EY, very resourceful global organizations, to bring knowledge to the organizations and to help them think through the next steps. One of the very impactful programs I've seen run was what we were calling the 100-day business plan. So where you think about recovery, the next 100 days, I'll have my rent to pay, I have obligations, and you are able to develop scenarios as a small business, and we provide you with the tools, the thinking around it, the resources, so that you can be able to navigate. Because, when you're in a crisis, you're typically stuck.
Yeah. So let's get into that one. The 100-day business plan. So somebody is already in this period, today being the 18th of May, they shut down their business for the last 2 months. And this webinar is basically telling them what to think of for the next 100 days. But so once they think, then what?
So once they think, they're able to develop a business recovery plan, and then we link them to mentors, coaches, people who can support and work with them, because we are a support network. So we've created an ecosystem of different people, business development experts, coaches, and mentors. But most importantly is that we also partner with banks. So we are supporting them to be able to also access bank funding. Okay, we're also running programs in conjunction with banks. We've run a program with GT Bank. We'll be running one with Equity around the country, Stanbic, and the rest. Because that is what they need. They need support, business support, and they also need money.
Wangeshi, let's just do a practical example. Assume that I have a barber shop. I have about 5 employees, and my shop was thriving before COVID. But then now comes a time when everyone is thinking, anyway, it's not so bad to, spot an afro. You don't need to go to the barber shop.
I know.
How do you help my business?
Yeah, that's a tough one, because you will only get help, for instance, if it's financing that you need on the basis of your cash flow. If your cash flow is not healthy, so the first thing we start with is assessing your cash flow, looking at where the demand is. If you don't have any business, now this is the time to start pivoting, rethinking. What else can I do? And there are very many businesses like those, as I mentioned. So we are pointing them to also where there are opportunities, how they can partner to pivot, because pivoting requires a partnership approach.
So
you need to figure out.
Giving the practical example of a barbershop, take us through. So I have shut down my business because clients are not coming. Nobody wants to come and have a haircut or have their hair done, or even have their manicure, pedicure. None of that is now happening. And this is the business that I have, that I've registered. What do I pivot to? To
new opportunities.
Which are? To
start thinking about new opportunities. There are very many, but you're not going to pivot and start tomorrow. That's the reality. That is what is so difficult as we speak now. So it's to help them to start opening their minds to new opportunities.
Yeah.
How you can go online with the same business, how you can get clients with the same business. But the service industry is the most affected, because even if you were to train me on how to barber my hair, am I going to pay you online?
No.
I'm not going to pay you online. So that's where the challenge is, and that's why they need to think about new businesses. new emerging areas. And one thing that is interesting is that during this same phase, we have an emerging group of people whom we are calling COVIDpreneurs. They've come up with totally new ideas.
But
And the reason why,
I'm thinking, look, so COVID is gonna be here. Let's even give it another 2 months or 3 months of this lockdown, right? If I start thinking of a completely different business, what happens to my barbershop? By the time we are opening, I'm sure people will want to come back to the salon. I'm sure, even if not 100% of my customers will come back, but at least a sizable percentage of them will come back and they'll want to have this haircut. I'm one of them that will be going back to a salon, to a barbershop. But if I start thinking of a completely different, COVID era business, then I've diverted my attention from thinking about how to even grow my kinyozi when we reopen to something different.
Exactly. So remember when I talked about the 100 business plan?
Yeah.
We take you through different scenarios, and there are 4 scenarios. What cash reserves do you have? Because when you're in a crisis, you stop spending. And then we look at how much time can the reserves that you have stretch you to. If it's 3 months, then stop spending, utilize what you have, save up, because this is the rainy day. Beyond 3 months, what will you be doing if the scenario doesn't change? So you need to start thinking about navigating what the next 3 to 6 months will look like. Will it be a new business? Okay? Remember that you have your own businesses. You have your own clients. You have to keep them engaged. So how do you retain the same business? You have to stay connected to them. So that's why it's a very comprehensive toolkit that enables the business person to focus on the business as it is, on the worst case scenario, on the modest case scenario, on the ideal scenario. Yes, but SMEs are so resilient. They are so quick at innovating. That's why they're small. And that's the beauty of being small, is because they can jump into something else temporarily or even sustainably. Yes, quickly to survive. You're talking about survival. Yeah.
True.
And if you don't think like that, how are you going to pay your bills?
Right.
Yes. So we are pointing them to where the demand is and where do you have the strengths? What skills do I need to get into that business? What resources are available? So we are partnering with many universities, organizations, business people. We've got resources and toolkits to help them to be able to refer to what they can do at this particular time. It's a very difficult time. No one has been through this before. So we need to work with them.
To work together. Wangeshi Muriuki, Country Director of Invest in Africa. We thank you very much for speaking to us this morning. And keep tuned in to Spice FM and the Situation Room.
Thank you very much.
Have a good day. We still have the lines open, 0719-012-600. We'd like to hear your experience. If you run a small business that has been impacted by COVID-19, whatever kind of business, we'd like to know what it is, what you're doing now, what kind of lessons you're learning, how are you able to pivot? Are you thinking of the future? What kind of support are you looking for? Are you seeking? And where would you get it? This is the Situation on Kenya's biggest conversation. So you can give us your comment on Facebook, Spice FM KE, Twitter @Spice FM KE, and 0719-012-600 is the number to call. Good morning. It's 8:45.
You are tuned in to Nairobi's #1 soul station, Spice FM.
Like Wangeshi was saying, there are very many companies that have thought of what else they can do, what they can move into, what other business that they can be engaging in. Like we know very many of the companies in the fashion industry those that were making garments, like now you're talking about weddings, or you have a special occasion and you go into a seamstress or a company that does garments. And these are the ones that are providing us with these very fashion-friendly masks, face masks.
Yeah.
So basically, you still have the material there with you, and you're thinking, right, this is the direction the market is heading. Let's
Let's
make
move.
face masks. Many of them from just their offcuts of the material that they had, and they have found a very useful way of heading that direction. That may not be the case for other businesses. Like now, the kinyozi. What do? You cannot say, I'll come and offer the service to you at home. The issue is not you coming to the premise.
But why not?
The issue is the distance.
When we talked to Kempinski, and they can offer you the same dining out, eating out experience, why not look into offering kinyozi services at home, salon services at home, move to where people are?
Why is it that people are not going to the kinyozi?
Physical distancing.
It's not because of the crowding, because you can also say that I'm only accepting 2 clients per hour. But that's not it. It's because of the distance between the person who's working on you and you. And that will not change whether they're working with you at home.
If you have a trusted kinyozi, you make them wear a mask, they come to your house, you sanitize them, you decontaminate them, everything, and then now you can start work. And you give them even an
N95 mask and a screen.
You even give them an N95 mask, give them a face visor, all of those things.
Maybe that's what would be looked at in terms, because look, what did we hear the other day with Amazon and Jeff Bezos, right? Likely to be a trillionaire in the next 2 years, next 5 years, or whatever is being forecasted. Why is that? He had a business that was already flourishing, but then he's gone deeper into e-commerce and realized that, okay, people were coming to get this stuff off of my site anyway. So we come together, several suppliers the world over, meet in one place. But then he's taken it to its nth and said, all right, we can go further, and even whatever it is that you want, we bring it even closer to you. You're still getting the same things, but we take the next step and bring it closer to you. Now, it would say, okay,
closer to you being what? Doorstep.
Yeah, doorstep deliveries, whereby they would say, okay, well, you could get this in 7 to 10 days. But then what they've done now, how has this changed? How is he touted to be the next trillionaire? It doesn't mean he's selling anything different. It doesn't mean he's bringing anything new. It's the same thing that he's doing, but he's tweaking it a little bit to say, all right, can we shorten the period within which you would get it, for example? So then you have more people on board, less people are going out. So then they realize that he's put now himself front and center so people can understand this is the first port of call, putting in fast food deliveries, for example, on the Amazon service where they were not there before. Things that people are going to look for, bringing them and saying that this can actually work. Everything that you would ever need is available on this service, and we will bring it to you.
Works very well because this is delivery of services, right? And now people, because we are doing online shopping, we don't want to go into the shopping malls. There's all this lockdown across the globe, and very many restrictions on how to even access the malls. So that works perfectly. Now, in the other businesses, like we're saying, you forget the big restaurants, like you're telling us, like the Kempinski, and they're taking the Luca experience to your home. But your ordinary kiosk, the Kibandansky, now, how do you... They're making githeri, making chapati madondo. You're at home, you're able to make chapati madondo. You can make that.
All the time.
So what does that person do? What is the next level for them?
This is the thing, and I'm having a problem reconciling with this because I don't know what they would do. What is this? What is this lady who is selling? Like we gave in the example.
Maybe save. I think maybe save
Who's
you that
going to
whole
construction
thing of
and there's no
boiling the
construction.
maize and beans for long. So they boil the maize and beans and they come and give you and sell it to you. So you can
So
just
you
take
just
that package
fry.
and go and fry. Put it in the freezer when you need to cook.
Or remember, we still have lots of bachelorettes, especially in the city.
Yeah.
Just make a schedule and go and make for them food at home so that they pay you for that service of making food at home as opposed to them coming to buy. Yeah. But then again, you'll just have to do the usual measures of keeping and maintaining hygiene as much as possible. So I think it's an opportunity to rethink how we do our businesses. And how I see it is that most service providers now need to go to to the clients, because the clients are unlikely to come to you. And that's
you,
why we
yeah.
are seeing that Amazon is actually thriving, because they were already in the business of going to the customer. Now they are just cementing that by making it as convenient as possible
Seamless
for the
as well.
for the client.
Yeah.
So maybe we need to rethink. We may not be at the level that Amazon is at, but with the level, or at the level we are in, we can rethink and repurpose our businesses. Still offer the same services, but think about, how do I make it, one, convenient for the client, two, easily and readily accessible. Unfortunately, and has always been my experience with most businesses in Kenya, the customer experience is not always the best.
No.
We assume that the customer is our right. So this is the time when we need to realize that customer is actually important. Without that customer, you don't have business. So we need to be customer friendly. We need to offer the best customer experience if our businesses are to thrive.
I do think, however, that there are some businesses that have, by virtue of the nature of the business, have shut down. I mean, if you want to look at air transport, for example, in that case, I mean, I hate to be the doomsday whatever, but there's nothing you can do. Look, if there are no flights, there are no flights.
That's it.
Yeah.
That's it. There's no kind of different kind of thinking or that
If
you will
you clean at
employ.
the airports, you clean at the airports. That's
Yeah.
it.
Done.
That's it.
So, I mean, what are you going to do? You
and
have
then
to wait
even-
until things come back to normal.
And then even looking ahead, even when the skies are open, traveling will now be a hectic experience. It was already bad enough, all the checks and everything around it. Now it's going to get worse, not just the traveling bit about the airports, you have to mask, distance and whatnot, but even the destination where you're going to. There's
There'll
bound
still
to
be
be
issues.
so many restrictions. So we're about to see the traveling business suffer some more.
Let's go to the phone lines. Shiro is calling in from Nairobi. Good morning, Shiro.
Morning, how are you guys?
Good
Fine,
morning.
thank you. Good morning.
Good. Thank you very much for bringing this subject up.
Yep.
For me, what I do is I train kids in sports, athletics. And I consult, I come into the school. So I'm not employed by the school. And I do things like I train in golf, table tennis, and horse riding.
Yep.
Now, schools are closed. There's no way I can teach a kid to ride a horse because we have to be in contact.
Right.
Golf, the same thing. So how would you suggest? What would you say? Because even if I go online, there's so many other people who are doing it online.
Right.
And now the schools, from what I understand, are going to be just, even cafeterias. They're not going to be having lunch at school. So even the schools are saying PE. What do we do about PE?
It's going to be done differently. So now, because you're already playing in this field and you already had a client base, and they still have the same need. The children still need PE. The children still need to know a couple of sports. What is it that you could do in the meantime now with online learning even? What is it that is possible for you to achieve easily?
Well, what I'm thinking of is now I've talked to the schools
Yep.
and talking to the parents, because even if I go online, I still have to make a living.
Yep.
So I need to know how my coaches and me, we have to make a living. How are we going to be paid?
Yeah.
So the whole thing is that the schools are saying, look, right now parents have trouble with paying school fees, and then you come along and you say, add on this amount
Yeah.
for me to teach your kid online. You see, I'm caught in a catch-22.
True.
Because you're going to say, forget it. I'll teach my kid. I'll go on YouTube and teach my kid. Right now I don't need my kid to have that one-on-one. So what would you suggest?
That's actually a tricky one, and that's something that Wangeshi Muriuki of Invest in Africa may be also able to assist in, in terms of that thinking of how to pivot and all. You can get in touch with Invest in Africa. They are online, and you can see what kind of support that they'd be able to offer you, or any other organization that's thinking that way. But I think this is the time when we're saying that if you're running a business and you've got to think outside the box, how far outside the box are you willing to walk? Might you find yourself in a whole different realm or different environment that you will not even be able to walk back to your box?
That's true. And then that's how many years gone down the drain of hard work.
Yeah.
You know what I mean?
Yeah.
So, although schools will reopen, so hopefully when they do, I'll be back.
That's the thing. I don't think that, it would look like that, but I wouldn't say that all the years of, sweat, blood, and tears that you've put into that would be a complete waste, because we're looking at a situation where, yes, we expect things to come back, however, may not come back in the way in which they were before, but you will be back. But so it's asking for temporary change, or looking at something else that you could do in the interim. And that could also prepare you for when it's back, so that you have the mindset that, things could change. So I think that's what we're going to go into, working, knowing that things could change at any one time. But I think you also have a splendid opportunity to do something else in the meantime. And I think you might want to, this presents you an opportunity to look at something else that you can do, as opposed to staying in that one area. That will come back for you. I mean, that's for sure. It will come back for you, but here's an opportunity to do something else and something more. Yes.
Very true. I mean, it's just a bit sad because, kids are having cabin fever. And even if you take them back to school, they still need, they've got that energy, inside.
PE is important. There's absolutely no way schools are going to do away with PE.
Yeah, exactly. Exactly.
Shiro, thank you very much for speaking to us this morning, and we wish you all the best.
All right. Thank you. Bye-bye.
Coming to the top of the hour, today's proverb: when a handshake passes the elbow, it becomes another thing altogether.
I'm going to go with a hug.
But I'm wondering, in this post-COVID era,
no handshakes anyway.
There are no handshakes anyway. So we may need to modify that proverb into something else.
Coming with your handshakes, doctor says no.
No handshakes.
Well,
no
basically
hugs.
What it's telling you, when somebody is trying to become a bit too comfortable in your space, watch out. It's no longer a handshake. Good morning. It's 9 o'clock.
Okay, so things on Thika Road have escalated from just a little bit tricky to bad to worse. It's bumper to bumper. Everybody's outdoors today. I don't know what's going on, but it's causing some panic attacks across board. I know it's going to open up, but for now, you're just going to have to be patient, folks. You don't know what's causing this, apart from the fact that everybody's out, all right? So from roasters all the way to town, it's moving very slowly, though there are no incidents. We just have to be patient in this case and then see what it looks like later on. All right. Mombasa Road is looking good, very slow at some points, but generally it is A-okay. Spice FM, KE, that's how you can reach us on Twitter. Let us know what you see, but for now it shouldn't be so bad getting around.
This is The Situation Room, the home of hard-hitting political commentary and penetrating insights about the state of the nation. This is a talk radio experience like no other. The Situation Room, a place for hard truths, debates, and elevated conversations. The Situation Room, witty, political, engaging, deep, controversial. In the room, we have C.T. Muga, researcher, academic, seasoned political observer, a fountain of wisdom in these politically uncertain times.
Welcome
Ndu
to the Situation
Oko.
Room. My name is Dr. Mercy Korir. In the room, Ndu Oko and Eric Latif. So we shift gears back to the health sector. And we are looking at what is happening at the health sector. Are people going to hospitals? If people are not going to hospitals, what has been happening? And let me just read for you a certain post that has been making rounds on social media. You have probably come across it. If not on your WhatsApp, it's on your Facebook, about somebody who posted about what he had seen in the private hospitals. And he says that I've been to several private and mission hospitals and they are struggling to break even for lack of both inpatients and outpatients. One popular hospital that has bed capacity of 120 and has always had 100 plus at any given time has been having inpatients fluctuating between 10 and 20 since March. Outpatients have been between 400 to 500 daily, but now even getting 50 is a miracle. On Thursday, this particular person sat down with a general practitioner and they sought to understand why this was the case. And the general practitioner thought that probably the illnesses are driven by the entertainment industry. Now with the bars, restaurants having limited clients, then you find that your choleras, typhoid, amoebas, food poisoning, and such kind of infections are no longer affecting people. So people do not need to go to the hospital anymore. That was one. The other one is that with the restricted movement, the curfew, so you find that accidents have reduced.
Road accidents.
Road accidents, yes. Road traffic accidents could be drunk driving or just accidents by virtue of people being on the road so many times have reduced. And then you find from NTSA data also, most of the injuries and fatalities on our roads have been pedestrians. These ones have reduced significantly. So the health industry is no longer as robust as we thought, which is ironical considering that we are
Should
in
be
a
a good
COVID
thing, but
pandemic.
here we are.
Yeah, but here we are that hospitals are struggling. So is this really the case, or is it an anecdotal view of what is happening, that this is just a biased view of the situation? But, well,
So
we want to
here
understand this.
we are dealing with a public health emergency that is making everybody stay at home, and so that we do not overwhelm our healthcare system, and yet our healthcare system is underwhelmed.
Is exactly by
Basically,
the things that used to affect it.
People are not going to hospital for the minor things that people used to go to hospital for. In terms of admissions, when you look at admissions, what was the percentage of, different cases that would lead to admission in a hospital?
So you would get admitted so it could either be an emergency or the cold cases, the elective situations that you need. Probably, let's say you need surgery to fix something, to correct your bones. There are elective cases that would need admission. Then you have the emergencies. You've gotten a heart attack, definitely you need to be sorted out. You've gotten a stroke, so there have been those things. So either of those could cause admission. So they could have gone down, particularly the elective cases, because remember at the beginning of COVID, the Ministry of Health, through the Acting Director General, they had given a notice to all hospitals to halt any elective cases. And here, actually, that was, maybe in hindsight, maybe not the right thing to do, because some of the elective cases could be somebody suffering from cancer and you need to excise a tumor somewhere. So if you have cancelled anything elective, what happens to those people? So maybe in hindsight, we need to correct that. Dental procedures, eye procedures, some of those things that need a planned surgery or planned something to do. So that is now some of the things that have been affected. I was having this conversation with some of my colleagues still in clinical practice, some managing some facilities. And how this have been affected is that everything that is happening, all the measures happening around COVID, have an effect on the hospital ecosystem. Industries, companies, organizations are laying down people. People are on unpaid leave, so people do not have ready money to go to hospital. Remember that most of the population rely on out-of-pocket expenditure for hospital care. So that means if it is not urgent, if it's not an emergency, I'm unlikely to go to hospital.
Yeah, to go and spend
that
money.
that could explain the numbers. And if companies are laying down, then it means if they've taken an insurance cover, they're unlikely to renew it when it expires, at whatever point it expires. So that means the people who are under a certain cover, when it expires, if they do not have an alternative, they are not going to seek healthcare services. So what is happening in this other ecosystem is now happening here. Now you have people who are still in employment or people whose covers are still running. While they could go to hospital before because of something minor, now they are rethinking it. Do I really have to go to hospital? Then you find that people with insurance covers are not really going to hospital unless it is absolutely necessary.
So then I have to question, then what has been the practice over, the longest period of time? Is that then quite a number of people have been jumping into hospital and it's not
And they don't
need to actually. You can actually stay home and take a little bit of rest, drink a gallon or two of water, eat a fruit or three, and you'll be fine. So it seems then that the hospital system has been taking in quite a number of people and prescribing care when it was not necessary.
Yeah. Admitting you when you don't need to be admitted.
Admitting you when you don't need to be admitted.
Yeah.
Probably doing a surgery when it was not necessary. Giving medication when it didn't need to happen. It sounds crazy, but it's true.
It's a possibility.
Yeah.
Let's ask the hospitals, all right?
Yes.
Our friend Dr. Abdi Mohammed is the chairman of the Kenya Association of Private Hospitals. He's on the line with us. Good morning, Dr. Ari.
Good morning. Good morning. How are you?
Good morning.
Well.
Good morning, Doc.
You've heard our last line, what Hindu is saying, right?
Yes,
So-
I have heard clearly.
So you guys are not doing very well in business. When we're talking about businesses that are affected, we also need to add in hospitals.
Definitely, you need to add into hospitals. But what we need to understand is it's not just hospitals that are being affected. It's everyone. And I think Dr. Mercy Korir has spoken to it. And it's a global issue. It's not just a Kenyan phenomena. If you look at across the world, you will hear NHS has received almost 29% less patients over the last 2 months, April and May. So meaning it's a global phenomena. And ours, you have other issues that arise as well. For example, you have night time curfew. If there are no public transports, so you can imagine how many people own their own cars, even if it's an emergency. So they will not seek care.
I think the first thing that we'd like to do with you, Dr. Ari, is we are seeing this forward on social media of somebody saying that they spoke to a doctor and this is the information that they got. Now, can you confirm whether this is actually the situation in the hospitals?
Unfortunately, it's in terms of numbers being reduced, yes, that's true. And it's both public and private and mission hospitals. It's not just only private and mission hospitals.
That's everyone.
That's the truth. Yeah, basically it's everyone.
All hospitals.
All hospitals are seeing low number of patients. So the issue is what is it that is causing that people are not seeking care? It's a number of reasons. One of the reasons is, yes, road traffic accidents have reduced. That's fine. But how long would you want to stay indoors? So that can't be the only reason. It's all these other reasons. But the biggest number one factor is the public are scared of coming to hospitals because of fear of contracting COVID,
in hospital.
the virus in hospitals. That is the assumption.
Or,
That's
if I can
one.
add in one thing, or fear of going to hospital and being treated, or rather being tested and found to be with COVID.
Yeah.
So there's the fear of contracting it in hospital, but there's also the fear of going to hospital, being tested, and then being found out to have it, and then not going back home.
Thank you. That was my second point,
Ah,
which,
right.
which is to say that you will call for me the man in white.
Yeah.
Yes.
There has been the man in black for them.
As in the men in
But
spacesuits.
Now, yes, in spacesuit, in white. So the fear is what will happen to me and to my family. So you call for those guys, they come, they test me, they find I'm positive. They go and harass everyone in my house, take them to somewhere I don't know. I need to pay for their quarantine. All those things were some of the reasons why someone would be scared to come. And if you remember, certain parameters that were being tested or screened, which also shares with other diseases like fever. There are many conditions that will cause fever.
Yep.
So if you have fever, normally you would have gone to hospital or you would have self-medicated. But chances are, if you have a cover and if you are insured or you are being paid for, you might go to a hospital. But now you will be hesitant going to a hospital. You will ask yourself, yes, actually anywhere that you will try to enter, if it's public transport or what, they will test and tell you your temperature is high. They will not even allow you to proceed further.
Okay. Dr. Mohammed, now if we look at what takes people to hospital in Kenya, I'm sure you have these statistics. Generally, if you look across the board, there's certain things that take the majority of people to hospital on a regular basis. What are those?
Number one is emergency.
Emergencies,
For
okay.
whatever reasons, whether it's through an accident, whether it's through maternal health issues, whatever it is, an emergency is what will take you to hospital, number one. Number two, for outpatients, generally is in the private sector would be these common communicable diseases, which is you have upper respiratory tract infection, you are coughing, you have fever. Those are the main things that will take you. Number three would be you have a long-term care. You have a certain non-communicable disease, and you have continuous follow-up, which is clinics that you go to. Or sometimes it's complication in that non-communicable disease that you have, which is diabetes, and then you have your sugars are high, or today your blood pressure is too high, or you are feeling certain headache, certain symptoms that you have been given that make you now go to a hospital. Then there is the fourth category of people who will come maybe just for general checkup, wellness sort of. Can you test me for X? Can you screen me for this? Can you screen me for that? Then there will be the fifth or the sixth category where you will have guys are coming, they have symptoms that are non-existent. So when you now test, you look at and you say, there's nothing. But you see, you can't dismiss that person and tell them, I've looked at you by just standing in front of me and tell you you don't have anything. So as a hospital now or as a doctor, you'll be forced to test, do certain things just to remove the doubt or the fear. Or maybe that person is communicating, in other words, telling you I have a mental health issue. So you need to refer me to a mental health expert, which sometimes you could be missing. Because we look for the organic diseases that we can test, and in the process forget there is a mental health issue. Yes. So those are the main broad categories, I think, that makes people go to a hospital. Of course, there will be the few who will misuse their insurance card. Like someone has, Yes, I will call it misuse because if you are not sick, I don't believe in. One thing that people don't realize is even as private hospitals, we would prefer or would like the insurance industry to be sustainable.
Yeah.
We don't want them to fail. So I say misuse because you are shopping in a shopping mall, then you realize the insurance cover is expiring maybe in 2 weeks' time or 3 weeks' time. Then you realize it has still 100,000 or 200,000. Then you say, there is a health center here. Let me just go in. Yes, let me just go in and talk to the doctor.
Yeah.
Then they start, the whole family walks in, then they start giving you stories of, this child was coughing 2 weeks ago. Then you ask, honestly.
People do this? Really?
Actually, they do. They
really?
do. They do.
Yes. There is lack of understanding of what insurance is all about.
In that case, then, Daktari, the insurance sector should be celebrating, especially the medical insurance. If people are choosing not to misuse, then it means claims are low. Then insurance is celebrating.
Oh, but you see, it's celebrating on one side and it's not celebrating on the other side because people are not renewing their cover.
Oh, yes.
Yeah.
That too.
Okay.
That too.
Should it?
That too.
Cause and effect.
Again. Yes.
Now, let's go into what Ndu had said, Dr. All right?
Yes.
So, clearly now, people are not coming to hospital. And we are not hearing stories of people who are being buried left, right, and center because they fell sick at home.
Yes.
We are not hearing this. So, like Ndu was saying, it clearly shows that we've been well all along, but we've been going to hospital for one reason or the other, and then we get admitted for reasons that we didn't need to get admitted for.
That's false. Number one, you have heard that the death for COVID, some of the patients are dying at home.
Yes.
Number one. There are others who are still dying at home as well. So number three, you are not coming to the hospital, but what will happen is you will come maybe 2, 3, 4 months down the line with complications. So now, for example, you are pregnant. You don't go to a hospital, you feel like there's no need. Then you miss on the antenatal care where they will find out whether you have preeclampsia, whether you have low HB that you need to be treated for. So basically, there are many things that will be missed along the way.
Okay, Dr. This is understood, right? We were looking at, because this is why I asked the question about what brings people to hospital. If you look at the emergencies and the reasons why, you have somebody who's in labor, and you have, horror stories that we've heard in the last couple of weeks. People are in labor, but they would rather wait it out at night because they don't want to get in trouble with the curfew, and then they go to hospital in the morning, right? Keeping people away from hospital, maybe an extra night has been saved, right? But if you want to look at the infections that you talked about, the coughing, the bacterial infection here and there, the tummy ache, people are treating themselves at home. People are not coming to hospital. So my point is here, are we not looking at a state where people have come to the realization that they can actually take care of some of these issues at home with some kind of back-end experience that they may have had previously?
No.
No? This is what people are doing. If I can make it clear, this is what people are doing. Are you telling people they should stop? I am telling you for a fact that this is what people are actually doing. They're doing it now as we speak.
Get a running stomach, wait it out.
Go to the chemist and buy a charcoal pill, and that's what they'll do.
No,
I'm not even trying to be facetious here. I'm telling you what's happening.
And I'm trying to tell you that that's what they're doing, yes, but that's wrong. You know what happens? You could be treating yourself for cough, assuming it's just cough. You continue this week, next week it subsides a little bit, the third week. you are managing your temperatures, everything, your cough, but you don't realize that could be TB.
Yep.
Secondly, you could be having diarrhea and you're assuming it's just normal diarrhea.
I talked to Dr. Google, and Dr. Google says one thing.
But Dr. Google will start with colon cancer.
Yep.
Yeah.
So
And scare you to
Scare you to
Scare you
death.
silly.
In fact, now I'll not go to hospital.
Now,
No,
we'll
good.
definitely not go to hospital.
So you rather seek the professional help whereby you are assured of getting the correct diagnosis. Even doctors themselves.
Ideally, doc, this is true. Ideally, this is what we should do. All right. But then you look at yourself, you're, let's say, 40 years old, and you've had several bouts of a common cold where you've gone to hospital and you've never been told you have TB. You've never been told you've got other, major infections. So what are the chances that this one time
It
You
will
have
be
TB.
I
TB.
have TB?
You don't know. It could be as high as possible. So the question, the burden of TB is with us. It's not like some unique disease that is found in other countries. And that's what I'm trying to say. So you will have, I remember in one of our lectures, they used to say common...
Things occur more commonly.
Exactly. So the people who are suffering from TB are you and me and your relatives.
Yeah.
So there are not some aliens who are in Kenya who only have TB. So the question is, do you want to take that risk? Then, unless you are saying you are not going because you don't have the money, because your insurance cover have expired, and now you can't afford, those are things that are understandable, but not I can treat myself at home. It's impossible. It's impossible.
Okay. Now, Doc, looking at all these issues we have raised, people not seeking healthcare services because of one reason or the other, and we were earlier talking about businesses needing to reinvent, re-innovate. Are we likely to see this from hospitals? Because then it's a service industry. You need us not necessarily to fall sick, but also just to, check our well-being. The regular checkups, the annual checkups, which you tell people to do. Are we likely to see hospitals, whether large or small, reinventing and re-innovating the way they do their businesses? Because it's a business.
Definitely, the issue of teleconsultation will take some effect and will get some traction. But all these other things, you will still be needed. Whether it's lab testing, you will need contact. Whether it can be done from home, I don't think we have reached that level of wealth in our country that someone can call in a lab person to come and do tests for them at home and pay extra amount rather than them going to the hospital or the laboratory directly.
Right. So at the risk of sounding morbid, then the hospitals or health facilities sector in this country, or any other country for that matter, you actually need or want people to be sick in order to stay afloat.
No.
Well, they're not coming to hospital because they're well.
The emergency. You get an emergency.
I mean, you need them to have an emergency or to have, some complication in order to come and to keep businesses afloat.
But what you need is, as an individual, that's why we advocate for wellness. Like every year at the beginning of the year, you need to be screened for certain things. When you reach a certain age, you need to be screened for certain diseases because chances of you getting those diseases are very high. But you see, the challenge has always been the public don't feel the need for screening. The uptake for screening is very minimal. We all know cervical cancer is the biggest number one killer for women in terms of cancer diseases. But how many women will do pap smear and go out of their way and do those tests?
But even now,
Very
Doc,
few.
people are unlikely to come out, as we were saying earlier. they are unlikely to come out to hospital just for that regular check because there's fear of getting COVID or the fear of going and possibly being tested for COVID or contracting COVID along the way. So somebody is weighing and seeing, do I need to know this now or should I wait it out? So during this COVID period, during this pandemic, how do you incentivize or encourage people to come to hospital because their other diseases have not taken a break? They are not on holiday.
True. What we need is the Ministry of Health needs to come up with the same campaigns to inform the public that they need to be going to hospitals.
Mm-hmm.
Like yesterday was World Hypertension Day, for example.
Mm-hmm.
How many Kenyans know their blood pressure or even measure regularly?
Mm.
Mm.
Then the first time you realize you are hypertensive is when you have a stroke.
Mm-hmm.
Very unfortunately. So the hospitals are still open, both public and private hospitals. So there is a way that needs to a communication from the ministry to inform the public that you need to seek services for these other diseases, because there has been a lot of gains that we have made on maternal and child mortality, on HIV prevention, and TB control, all those things.
Mm-hmm.
But now all of a sudden, if you let it just go, then the burden will be bigger post-COVID in maybe 2, 3, 4 months' time.
Yeah. So actually, this is the best time to go to hospital. You know, one of the things that I don't like going to hospital because is the queue.
The queues.
You are going to a hospital and basically your day is done. So unless I'm in that state where I really must go to hospital, I will not go to hospital and sit there looking at walls.
Exactly.
And a TV
exactly.
that's high up on the wall, craning my neck to watch that telly, and it's even next to a pillar. I mean, it's just a very uncomfortable
You don't like
experience.
hospitals very much.
Yeah, clearly.
I don't like sitting down waiting for God knows how long.
And that's why if you talk to the most consultants, they will tell you, I wish you could have discovered this a little bit earlier. We could have helped you. But now, we will just try to do things.
Try to
so
manage.
that late diagnosis is one of our biggest problems.
Yeah.
And it's because the public generally don't seek wellness. So by the time you come to us and it's late diagnosis, the hospitals are just doing patch-up. There isn't much there that's happening. But you see, when I tell you to come for wellness checkup, you feel it's a waste of money. But unfortunately, the same guy is servicing his car.
Yeah.
Yes.
Every 3 months or every certain mileage. But forgetting that even him, there's a mileage.
He needs to service himself.
He's catching up. Yeah, he needs to service himself, especially people who have relatives with certain non-communicable diseases. Like your dad is hypertensive. You don't need to wait for you to reach 60 to start testing your blood
test
pressure.
yourself as well. Okay, so these fires from COVID are going to die down at some point. There's a likelihood that we might live with COVID, and anybody could get it up now and then. How do you see the healthcare systems changing in this country based on what we've talked about now, Daktari, that people are getting into this habit of self-medicating and such? Do you see the way in which we do business from a healthcare point of view changing?
Yes, and I hope people will realize that health is the number one priority for every country going forward. It's a health crisis that has caused the whole world to stand still and realize that there's a lot that needs to be done, including research and all those things. But I don't know whether our MPs will realize that the Ministry of Health needs more budget compared to what's happening. Or our county governors realizing that ICU is not for the common man; it's for everyone.
Yeah.
So when you neglect your facilities, that could be your facility the next time there's a pandemic. So I'm just hopeful there will be a reawakening of realizing that health is very important in this country. And I hope the issue of UHC, which the president started, will be given a little bit more priority going forward, as much as there is a referendum on the way.
Let's take a short break, Doc, and then we come back and continue this conversation. Now, I think we'll want to focus a little bit more on what hospitals should look like post-COVID. You mentioned something like telemedicine working, and already teleconsultation has taken root. We'll want to know how well that is, and also looking at other ways of using online. WebMD was a collaboration by doctors to actually come up with a platform called WebMD, where you can go in and, it assists you to diagnose. How likely are we to see that working in this country? Or must doctors be seen physically, face to face? All right. Keep it right here. It's 28 minutes to 10. Let's take a look at weather and traffic. Good morning.
In Nairobi, still partly cloudy, warming up just a little bit at 18 degrees now. Highs of 25 and lows of 12. Partly cloudy conditions will remain through the city for the whole day. It's mostly sunny in Nyeri at 19 degrees. 23 the high and lows of 12 today. Partly cloudy conditions. Wet conditions will be in Nakuru in the afternoon. Currently, it's sunny conditions all through at 18 degrees. We'll experience a high of 24 in Eldoret, where it was a bit wet this morning. It's mostly sunny now at 18 degrees. Thunderstorms will come back later with highs of 22 and lows of 13. Taking a peek into Kisumu at 23 degrees is partly cloudy conditions. Rainy conditions in the afternoon, though, with highs of 27 and lows of 19. Taking a look into Malindi, sunny conditions at 28 degrees. It'll be cloudy though later with highs of 29 and lows of 25. And in Mombasa this morning at 27 degrees. Clear skies, sunny conditions. Only partly cloudy conditions in the afternoon. Highs of 29 and lows of 25. Take a look then into Kampala, where it's light rain showers being experienced this morning at 22 degrees. We will see thunderstorms in the afternoon with highs of 24 and lows of 15. Dar es Salaam is mostly sunny at 26 degrees. We'll see highs of 30 and lows of 24. Partly cloudy conditions through most of the day. In Johannesburg, it's mostly sunny this morning at 11 degrees. Sunny and clear conditions throughout the day with highs of 21. It'll cool down significantly though later to lows of 6. And for now, in Lagos, at 27 degrees, we'll see highs of 33 and lows of 26 with partly cloudy conditions. Take a quick peek into London now at partly cloudy conditions at 12 degrees. And we'll see sunny conditions following later with highs of 23 and lows of 11. And Paris is sunny this morning at 13 degrees with highs of 24. It'll be very warm in the French capital today. And finally, in New York, where the sun will be up very soon. 13 degrees, cloudy conditions through the day, partly cloudy in the early parts of the evening with highs of 21 and lows of 13. Still a bit of an issue on Thika Road this morning. It's moving bumper to bumper, very slow, snail pace, chock-a-blocked. I don't know what other adjectives you can use this morning, but it's just not moving. Getting in and out of the city seems to be an issue today, and I don't know why, but it seems that a lot more people are on the road this morning, inbound from Pangani to the drive-in. However, the service lane is all clear. You can use that as an option. I don't know how you're going to get on it, though, because you have to access the main road to do that, but you can try. For now, you have to be patient while using Thika Road. Mbaya, Mambo Mbaya is what we're being told today. Mombasa Road is looking a little bit better though, not much of a hold up after you've left Cabanas and left General Motors, heading then towards Nyayo Stadium. Getting onto Ru Highway then and into the CBD won't be too bad, and especially now, it's going to die down right after 9:30, 10 o'clock. So you should be fine then getting into the city. Round about the country, it's looking pretty good. We don't see much traffic this Monday morning, but where it is, you're going to have to be patient, guys. Spice of MKE on Twitter, that's how you can reach us.
Happy Monday. How are you doing? This is the 18th day of May 2020. The energetic trio in the situation of this morning. Very glad to Nduwoko and Dr. Mark.
Spice up your
and
life.
Also, the other person who's quite energetic and is joining us on the line is Dr. Abdi Mohammed. He is the chairman of the Kenya Association of Private Hospitals. We are talking about how hospitals are coping with COVID-19. We've also, of course, seen that numbers into hospitals, public, private, and mission, have dropped drastically. Now, what happens whenever any business has reduced revenues? It cuts costs. It cuts costs. It cuts costs.
That too.
That too, right?
Yeah.
Cuts costs.
Across.
Yeah. And we've seen that some hospitals and clinics are reported up to 50% dip in their revenues. 2 hospitals so far have notified staff of reduced of salary cuts. And a few others may follow because of the trend that we are seeing. We're only 2 months into COVID, and they had to scale down on many things, including the elective procedures we're talking about. And then we are seeing that people are not going to hospitals because, 1, the cash flow issues, 2, accidents are reduced. Even the hand washing has reduced diarrheal diseases. So people are not going to hospitals.
We're healthier, more hygienic.
Yes.
Hopefully
So
people will remember it, no?
I think it's a new way of life. And I'm particularly happy because of children. You know, children never forget.
Yeah.
So they'll grow up
They'll
as
grow up
cleaner
with this.
adults.
Yeah.
Yeah. So, Dr. with all of these
Yes.
things, as we kept saying, it's ironical that hospitals are giving salary cuts and laying off staff. How rampant is this now in the private facilities, in the facilities that you chair?
It's very common for many reasons. One, other than the low numbers of patients, you start with reducing what we call locum. So meaning people who you would come to fill in gaps within your facility are the ones who you will start with. And there were many healthcare workers who were not employed per se permanently. So they work in different hospitals at different hours and at different days. So the first people who it has affected are the locum staff. And unfortunately, it's not just one hospital, so it's across.
Yeah.
So you can't say this hospital has issues, so I will go to this other hospital. So that is number one. So there are many Kenyans, healthcare workers, who are just at home, waiting and wondering what next.
What they'll be called upon.
Then you also do all those other measures. You reduce your procurement, the things that you're buying. So that also translates to smaller businesses who are supplying milk, I don't know what, all those things for kitchen staff, pharmaceutical companies, transport. So you reduce as well. Then the next thing is you reduce your expenditure on extra benefits that you give to staff. For example, if you are paying for pension, you say, okay, let's remain with NSSF for now, as we see what happens next. So that also comes in. Then the next thing is reduce your leave, go on leave. So you will find healthcare workers who are now on leave, and we are saying we are fighting COVID.
Yeah.
So guys have been told, go and use your leave days at the moment. So that's also one of the measures to reduce your costs. Then the final step is where you say take a cut. So that's now very unfortunate.
That's
or
second
more
last.
so, if you are a little bit not aware on labor laws, that's when you say take a cut. But you see, that's very difficult. Someone can come back and say, I never agreed to it.
Yeah.
So the solution is you terminate. If it's 1 month notice and what, you do all the necessary documentation. That is happening.
So the
but
reality here,
more informal, smaller facilities might just go straight for the shop and say, you know what, in any way we didn't have pension and such things, so we can only reduce your, terminate your contract. Yeah.
so basically what we are saying is that the reality is we are fighting COVID, and we are saying that our healthcare workers are the frontline soldiers in this, but many of them are getting laid off.
Yes, especially in the private.
In the private sector.
Yes. Yes.
But what kind of measures are private hospitals or all these hospitals putting in place in case we see a drastic rise in the numbers and the demand rises?
But you will recall, the beauty is all hospitals know people who work with them.
Yeah.
They have their database. So chances are you will recall them back if there's a surge in numbers. But what also you need to realize is when there's a surge in numbers, you will have healthcare workers being infected and being quarantined and all those things.
Yeah.
So the demand will be even a little bit more higher than usual. We are already underserved. So that's why, in my opinion, the government actually should think of setting up separate hospitals. Like currently, the way it's just KU and Mbagathi that treating.
Yeah.
Replicate similar in all other counties, that you have facilities earmarked for COVID only. Yes. Then you can allow the rest of the facilities to be used by the public for the other diseases. Like in the UK now, the field hospital that they set up is not being closed. They just put it temporarily on hold. But when there is a surge, they will just reopen it for continuous treatment.
So, Doctor, with all these challenges, staff on leave or salary cuts or terminating, how then are you able to be innovative, do telemedicine, teleconsultation? If you need to do concierge by going to, take medicines to people or go to people's homes and draw blood, especially for those people like who've had organ transplant and are on immunosuppressants. Those are people you'd want to go to. How then is this going to happen if the situation is that hospitals are managing their businesses just like every other business is by cutting down on staff?
That would be ideal, what you are saying. But what we need is sometimes also to talk about the reality within our country. There are around 4 or 5% who might have private insurances of the population. Then you have another maybe 15-20% with NHIS cover. Number one, the 5% are the so-called wealthy or the middle class who work for big companies that can afford. The insurances have not accepted telemedicine because of the issue of verification, whether you are doing, you are treating the right person. So there was that fingerprint to be reascertained. So that's not possible to do it from home. Actually, some insurances have even written categorically, no telehealth.
My goodness. Yeah.
It has to be physical. If the person can't come, that's their problem.
Well, but this is where now I call you out. You guys and the insurance companies. Look, this country, we pride ourselves in having the best mobile
would
solutions.
Would you allow me to finish first so that
go on. Sawa, endelea.
As I always say, for any solution, I always look at the bigger picture. And for me, that's why I was giving you the issue of 3 to 5%. So you have 95% of the population who are not wealthy, who don't have insurance, but who now have been laid off as well from work. So when you say concierge, what happens is you are dedicating a whole healthcare worker or 2 people or 3 people to work on this one person. Go to their house, that's transport cost. take blood. So if your normal test was, let's say, 1,000 shilling, now you will add another 1,000 shilling for the transport, or 500 shilling, for example. If you add the drugs to be delivered, if the drugs costed 3,000, now it's 3,500 or 4,000 shilling. So the question is the burden in terms of the extra cost that will incur will be higher. So if you want to use the data, the patient needs to have data. So that's extra cost on their end as well. If it's just a normal telephone call, will you see or get everything that you require from the patient? Because sometimes you need to even have a look at if someone is telling you I have a wound, you just need to see it, how it looks like.
True.
That's a video call. So meaning there is more data. So the reality is majority of our population cannot. Yes, you might have the best infrastructure in terms of mobile and data, all these things. And then add the final part where security risk. Someone tells you I'm somewhere in the middle of Madare. Now would you send your staff to go and treat someone? So you even getting the address.
You know what, Dr. Mohammed?
Where do you stay?
I hear you on all these things, but you know what? COVID is gonna force you to actually think and stop looking at these as challenges. You'll come up with solutions around it. Basically,
definitely. I'm not refusing. We have to think, but you see, we have to look at holistically what addresses the issue of the majority.
True.
Yes, because you see, we might get a solution, but it will only serve the few people who live in this side of Uhuru Highway. Yes, and but you see, the whole population is on the other side of Uhuru Highway, Islands.
And those ones are served by specific private health centers that are close to them, that also can come up with solutions that serve in their communities. Basically, I don't imagine, for example, a big hospital thinking about everybody. They think about their main clientele. If a big hospital like the Big Four, every industry has a Big Four.
And I'm sure you have received those forward messages. They have introduced that service
on telemedicine and the rest, and delivering medicines at home.
But how many people are they serving? A few 100,000 people. Yes, they have done. All the big hospitals have done. They have lab at home, pharmacy at home, teleconsultation. They have done. But for me, what I look at is and that's where the majority of the small private hospitals are in the community. So when they are in the community and in the rural areas, then you have a big challenge. So what we need is more robust system to address. Like if we had those separate facilities, if we had those ICUs ready in each county, there was a budget for such. So there was even a budget for emergency fund to handle certain things. Then we wouldn't be having this issue. And enough education to the public and say, okay, please continue with your services. And then we will take care of COVID patients separately.
I was having a conversation with a group of friends. Apparently, one of the hospitals has decided that because they have a huge laundry, they're going to think about how to monetize that laundry. Now that we don't have many people in hospitals and we're not using our laundry to full capacity, how do we encourage people who require their linen cleaned to bring the linen to our laundry?
But you see, the problem is when people are very short-sighted or imagine certain things. Yes, I would want to maybe Eric Latif takes his laundry to somewhere. But Eric Latif maybe is being told by his company, your salary has reduced. Do you think he will continue taking his clothes to laundry? No,
he will wash them himself.
Look for a solution. He will wash himself. So yes, I understand the all those things you will try, but the reality is who exactly will take it up?
Who are you guys?
Who will take it up? Who has the money? Because we are looking at, you have suppressed the whole economy, almost. If you would have said it would be hotels, hotels are empty. So who basically would be sending, if it's fellow hospitals, they are cutting costs.
So, Dr. How do we get out of this? How do we stay afloat?
It's, of course, opening up the economy. That's the only way you can stay afloat, and people rehiring and giving loans with certain moratorium to smaller businesses.
So
because
we lift curfew, we lift restrictions
slowly.
of movement, or what do you mean by open up the economy?
You lift those things slowly. Like you can lift maybe transport out in and out of Nairobi. You have started with restaurants. Now next will be even the airports. Simple, slow, based on scientific. But the problem is we don't have enough data, unfortunately. So
what do you mean we don't have enough data?
Really?
The Ministry of Health is always giving us briefs about in the last 24 hours we've done so much. What do you mean we don't have data?
But you see, if you are testing 1,000 or 2,000 or 3,000 people even out of 45 million, it won't give you the correct picture. And even, it's not even, you are more doing high-risk testing, like truck drivers, contact tracing, those contacts. So you have not yet reached the level of saying in each county we are doing random testing. Like we'll go to a certain area, we'll just test people, or we'll go to a hospital, any patient who walks in with certain symptoms, or all the patients who walk in will start testing. So you are not doing that surveillance testing where you would say you will get data that tells you, okay, this is the prevalence in this community, in this area, in this place. Because I would expect, like, you have closed Isli or you have closed Old Town. How many people were tested in Old Town or Isli? How many? If you get that, that is the data that I'm talking about.
I know.
So this, you say this Isli area, Old Town, has 200,000 residents, and out of 200,000 residents, we have tested maybe
70%,
3,000 or 5,000 randomly. No, I don't think. Since we started, we are only at 40, at 40,000 for the last 3 months.
Yeah.
So I doubt we can test 100,000
in a week.
And I understand some of the issues are mainly to do with getting the testing,
procurement and
because
accessing them.
Accessing them, because there was a demand, and this is also some of the issues maybe the minister will need to take up with the WHO and all those world bodies, that when there's a certain issue like this, the supply chain is skewed to developed countries.
True. True.
Like it's not that we don't have money to buy, but the company that's selling will give priority to the country that they're doing business mostly.
Bigger business with.
So most, like Sanofi said, their vaccine, they are a French company, but they said their vaccine first will go to US.
Yeah.
So you can imagine how skewed that is. It doesn't even make sense.
It does
So
to them,
those are
business
some of
wise.
the issues that need to be addressed even in the global arena.
Speaking of that, of what you've just raised, Dr. Abdi Mohammed, the issue of, let's say, we've locked down Isli for 15 days, and in those 15 days, every day numbers are being announced of new COVID-19 cases. If at the end of 15 days, after all that lockdown, after making people stay indoors and not even access other parts of Nairobi, you still say you record, say what, 20, 30 cases of COVID after all that testing, what kind of messaging does that send out? That there was no COVID anyway in the first place. Why were you punishing us?
But you can't say, because possible there was COVID, but we have not tested. You see, if you don't test, you wouldn't know. And if the person doesn't come out also to be tested, also you can't know. And as we have seen, even the ones who have tested positive locally,
Yeah.
almost 70% are asymptomatic
True.
in the data, if you look at the reports that are shared. So now the question is, people are walking around, they are asymptomatic.
Yep.
No one knows you might be having. And it's not like a wound or something that someone can see when they look at your face and tell you, oh, you are COVID. Positive.
Yeah.
So that is the biggest challenge as well.
That we have.
And you could be spreading without realizing.
True. Dr. Abdi Mohammed, Chairman, Kenya Association of Private Hospitals, also founder and CEO of Lodnand Hospitals. Thank you very much for speaking to us.
Thank you.
And we wish you guys all the best in your business.
Thank you.
Thank you, Doc.
Wish everyone all the best, and hopefully, my worry is more of the economic impact than anything for the general public, because that will be the saddest thing. And I hope there will be some stimulus into the economy and into the public.
True.
And we will take public health care more seriously, especially research. Yes.
Asante sana, Daktari.
Thank you,
Have a
Doc.
good day.
Thank you.
When a doctor says, actually, me, I'm now focused more on the
economy.
than this disease.
There's a message.
Although
Things are thick.
You have to look at him. He's wearing the hat of a businessman.
Yeah.
He's thinking, look, I have a business, went painstakingly through the journey of building this business. Now here we are fighting COVID, and my facility
It's empty.
does not have anyone who is admitted because of COVID, but my facility is empty. And yet I know for sure that the people who are coming to this facility before COVID still
Still
require
need to
these
come.
services.
COVID needs to go.
COVID needs to go.
COVID needs to go.
Yeah.
But if you look at it, I think whether in the healthcare business or any other business, or being kawaida mwananchi, I think it's in our best interest, everyone's, that the economy survives this or stays afloat. Because that means then we will just suffer for a period of time, and then after that we can bounce back. Yeah, so whether we'll we'll deal with the complications of healthcare, of our diseases that will have arisen at that time. We will deal with whatever losses we have incurred, either socially, economically, but at least we will be there to deal with it as opposed to what we are going through now. So think the economy surviving is the key to everything else surviving.
Big. As we come to the end of the show, a reminder of today's proverb. It's an African proverb. When a handshake passes the elbow, it becomes another thing. Sometimes you get to know people, you become acquaintances with people, and then they start becoming a little bit too comfortable with you, and they want to venture even into your bedroom, so to speak. Watch out. When this handshake goes above the elbow, it has become something else. It's 10 o'clock. See you tomorrow. Ndu, say goodbye.
Say goodbye. Oh, wait, goodbye. Have a good day. It's like
See
a
you
parrot.
tomorrow, folks. It's 10
See you
a.m.
tomorrow.